Good morning and welcome to the 14th meeting of the Citizens Participation and Public Petitions Committee of 2025. First of all, apologies from the Deputy Convener, David Torrance, who's not with us this morning, but we do welcome back his substitute, Marie McNair. So good morning to you, Marie. Nice to have you back with us. The first item, of course, is simply to agree, colleagues, that we will take agenda items 5, 6 and 7 in private, which will relate to the consideration of the evidence we hear, and we will also be taking a decision on an anonymous submission, as well as looking at our work programme. Are colleagues content that we will take that item in private? We will. Thank you. Well, we come to agenda item 2, which is a healthcare thematic evidence session. So there may be people joining us this morning because as we move towards the end of the Parliament and we realise that time is running out, we are seeking with various senior ministers and their colleagues to try and get some final evidence on a number of petitions. And there are actually 16 health petitions that are incorporated potentially in the range of areas that we might end up discussing this morning. And to discuss those issues, I'm delighted that we have Neil Gray, the Cabinet Secretary for Health and Social Care, who says this is his first gig with the Petitions Committee in recent times, Alan Morrison, the Deputy Director of Health Infrastructure and Sustainability, and Douglas McLaren, the Deputy Chief Operating Officer. Good morning to all of you. And joining us as well are three of our parliamentary colleagues. We have Claire Hockey, MSP, Jackie Bailey, MSP, and Edward Mountain, MSP. Good morning to the three of you. And may I explain that we are going to be trying to draw the various petitions into 5 thematic themes. I know Edward Mountain. I think, Edward, it may well be that your particular interest is in theme number 1, in fact. He says, scrunching around for his notes when the most obvious answer is in front of him. But please feel free either to try and catch my eye or the eye of the clerks. I'm very happy for any of my parliamentary colleagues to join in at any point this morning, simply because we've got such a long series of sessions. So as we get towards the end of each thematic section, if there are questions they would like to put in addition to those the committee have put, then I'm very happy to hear what they might be. Those 5 sort of areas that we've thought to bring things together in are patient experience, diagnostic and treatment pathways, capacity, skills and training, sustainability of funding and health service infrastructure, and then post-COVID-19 impacts and response. And one of my colleagues on the committee will be acting as the kind of chargé d'affaires of each of these sections as we proceed through them. So I will start off with patient experience. A number of petitions demonstrate there is a gap between policies, strategies and plans and how services are experienced. Do you accept that there is a gap? Why do you think that is there, particularly at critical points in their life, such as in mental health crisis or when vulnerable around the birth of a baby or when feeling very unwell? And Cabinet Secretary, if you or any of your colleagues want to bring your colleagues in at any point, then that would be what.
Thank you, Convener, and my appreciation, first of all, for the opportunity to be here today. I have a lot of, as you say, it's the first time both in this room, but also appearing before this committee, and I'm very grateful to the work that the committee does in bringing forward areas of concern and interest that the public have brought forward. So my appreciation for the opportunity to be able to respond to some of those, given the number of potential petitions that we're discussing and the length of time we have available, I will attempt to be as pithy as possible in my responses. I think there can be gaps, as you've set out, Convener, around between policy and delivery, where that is in evidence. Normally that is due to capacity or demand level constraints. And there can be some variation in delivery between boards because of geographical or demographical reasons that will be understood. That being said, obviously I want to narrow those gaps between where demand and capacity is available and ensure that the patient experience is as positive as can be in sometimes very difficult circumstances, as you've set out. There can be around mental health crisis or other issues going on in people's lives. So clearly that is what I am endeavouring to deliver upon in consort with the 14 territorial and other national boards to ensure that we do maximise and improve patient experience.
So why do you think it is, though? I mean, because it does sometimes seem quite perplexing that there are a level of services available that seems quite critical, and it's available to those people presenting in some health boards but not in others. Is there any kind of collective thinking between health boards that takes place where there is a kind of review of the different ways in which they approach these subjects, or is it very much that they operate within their own sort of silo and decide everything without necessarily reference to what the more widespread practice might be? And I suppose, to be fair, it's not just within health. We see this sometimes within some public transport options which come depending on which regional authority, local authority is responsible for things too. But within healthcare, it's sometimes quite difficult to explain why somebody who's in the wrong line of a health board boundary feels that they can't get the same level of service as somebody else.
Yes, I understand that, and that is the constant dilemma between local decision-making and national decision-making, and where we rightly expect there to be local decision-making and priorities set at a local level, then there is the compromise that is brought there is that there is a level of variance. To answer the first part of your question, Convener, yes, while our territorial health boards are independent legal entities and are responsible for the delivery of services in their jurisdiction, I do bring them together at a national level and ensure that there is shared understanding of best practice, of resolving challenges, of ensuring that there are treatment pathways available, and also that we do blur the boundaries between those health boards. And I'll give you an example. Most recently, we have changed the way in which we deliver planned care services so that we have our national treatment centres that are referred to from our territorial boards and our regional treatment hubs, because we recognise that in order to ensure that treatment is delivered in the fastest possible way, sometimes that means you need to deliver at a regional rather than a local level. And that is where our regular interactions with our board chairs and chief executives ensures that there is that greater coordination, and I expect particularly in planned care, but also for some other acute services, the service renewal framework will allow us to see better coordination of services between board boundaries than what we have right now.
Thank you. I mean, you see, sometimes I have to say the committee is alerted to conditions that actually we've not heard of before necessarily. It's easy sometimes when you're talking about kind of high-level services to sort of follow the pathway, but you then realise there are some, I mean, for people with hypermobile Ehlers-Danlos syndrome, for example, is one, and hypermobility spectrum disorders is one of those that falls into this category. And then when you hear the particular circumstance of the petitioner, who then explains what the condition leads to and the difficulties that they have, and the fact that they would get a more sympathetic kind of level of response and treatment than another health board, it's these kind of sort of slightly below the radar, for want of a better description, in terms of day-to-day household conversation conditions that can sometimes be quite difficult. And it does seem sometimes that, as a committee, the kind of responses we get from health boards or we get back don't really advance matters. It's difficult to see how you actually, because it's difficult for us to understand a justification for that being the case.
Which, on the likes of Ehlers-Danlos, colleague Emma Roddick has obviously brought great attention to this, as well as the work of the petitioner, ensuring that this is brought to Parliament's consciousness and that a greater public awareness of some of these rare conditions and diseases can have. And when it is a rarer disease, and you acknowledge yourself, Convener, that some of them perhaps we have not had cross our desks before, we have to balance again between where there is a demand and the level of need for treatment and where it is safe for that treatment to be delivered at a level that means that the clinician that is delivering it is delivering to a level that would ensure that they are safe to practice and they have that continuous safety to practice. So that is always a balancing act, and also where our territorial boards will have different levels of demand for some of these conditions, and that's where local decision making is also important, where they can make decisions around local priorities, where they've got higher levels of Ehlers-Danlos, for instance, or other conditions that they need to invest in and prioritise. And that's where blurring the boundaries between our boards, where I recognise that often travelling in order to receive treatment can be extremely challenging. And I'm originally from the Northern Isles, I'm originally from Orkney, and recognise that travelling for healthcare can be challenging, but also an expected part of living in some communities. We need to make sure that the boundaries between health boards are blurred, so that where a specialist service is being delivered, that can be done on a national basis, coordinated through National Services Scotland. And that's where our Rare Disease Action Plan is focusing in on, to ensure that we have a better coordination of where those services can be delivered for some of those rarer conditions.
Can we look then also at I know Edward Round, I'll bring in, at the centralisation of services, because this has become a much more common phenomena in terms of services we provide. One of the petitions we're not discussing this morning, as you know, is the neonatal care unit we visited as a committee in Wishaw. But leaving that one aside, when you're talking about centralisation of services such as perinatal care, or the absence of services such as full abortion care, or other specialised services, how do you assess or ensure that in providing what arguably through centralisation is meant to be a higher level of service because of the skill sets that are available, isn't, on the other hand, restricting access through boundaries that are then in the way of people trying to access those services in the first place? So, I mean, how do you ensure that that service and any kind of centralisation that takes place isn't actually physically restricting some people from thereafter being able to reasonably access it? Because we hear it comes up in the chamber time and again, and it's a common theme of a number of the petitions that we have.
So again, I go back, Convener, to the point around this being about specialisation rather than centralisation. And on the point around patients having to travel, the National Treatment Centre initiative has demonstrated that it doesn't always have to be patients from rural areas having to travel to the Central Belt. Actually, National Treatment Centre Highland is a good example of patients travelling from parts of the Central Belt north. And as somebody originally from Orkney, that pleases me greatly that we have that level of coordination, that we're able to see travel not just happen towards the Central Belt, but actually a level of service being delivered within some of our more rural communities and serving their interests as well. In terms of that balance that needs to be struck, sometimes that's on a national basis, where we need to take decisions on a national basis on a diagnostic pathway or a treatment pathway. Other times it is for local boards to determine how they are best able to deliver and serve their patients in those areas, working sometimes in consort with other boards, regardless of whether it is ourselves in government helping on a cancer pathway, or indeed around the specialisation and ensuring that we're serving the sickest babies for neonatal services. That has to go through an assessment of need, and exactly the questions that you're posing, Convener, around ensuring that we are providing a service that, yes, is specialised, but not doing so in a way that restricts access to people being able to get to that service. And that's where careful consideration has to be given, where public consultation has to be involved, where clinical input has to be involved, to ensure that we're providing the best services for people.
Okay, thank you. I know that both Edward Mount and Jackie Bailey would like to come in. Any member of the committee like to come in on this particular section? Okay, Fergus Ewing and then Davy Russell.
Two issues with regard to the first section of patient experience. The first is one that the Cabinet Secretary is well aware of, that I've raised incessantly since 2022, which is that vaccination services, because of the GP contract in 2018, were taken away from GPs and centralised. And this has been not only a complete catastrophe in the Highlands, but has also, as the Cabinet Secretary knows, led, it is believed, directly to the death of an infant, not in my constituency, but in the Highlands, because the mother did not get notice of the necessary pertussis whooping cough virus at the right time. Despite that, despite my raising that with yourself and the First Minister, and despite the fact that, as I understand it, Cabinet Secretary, you have now undertaken that it should be returned to GPs, it still has not been returned to GPs, and therefore people from all over the Highlands are having to travel to Inverness, sometimes a journey that they cannot make themselves because of infirmity or lack of ability to get access to a car or other means of transport, or they have to get their parent or a friend to take time off work. I mean, isn't this centralisation completely wrong? And why has the Scottish Government allowed this to happen in the first place? And when is it going to be restored to GPs, Cabinet Secretary?
Thank you, Convener. So this is something that Mr Ewing and I have corresponded, met on repeatedly, including with GPs within Mr Ewing's constituency and indeed Mr Mountain as well. I well recognise the concerns that have been raised. He'll forgive me if I can't comment. I've recognised the case that he has raised. I clearly can't comment upon it. But access to pertussis whooping cough vaccine is clearly very important. I would encourage any, particularly given the geopolitical discourse that has happened this week, I would encourage any expectant mother to access a vaccine that they are eligible for, and as we approach winter would also use this opportunity to remind colleagues that they should ensure that they are taking up the vaccines that are available to them because of the preventative measures that poses one of the best public health measures that we have available to us. In terms of the original reason, Mr Ewing asked why this happened in the first place. This was a request that came through the GP contract negotiations via the BMA in lead up to 2018. There is flexibility within the contract for local boards to take alternative measures, which is what I have worked with NHS Highland to say needs to happen. There has been an assessment of that in Highland, and there will be a flexibility in offering vaccination clinics with GPs leading, and I've corresponded with Mr Ewing on that. And we're currently in discussions with the BMA around their future funding provision and the services that they provide off the back of that. And if this is something that comes through again from the BMA, then clearly that's something we would continue to consider. Will it
be restored to GPs before the winter?
So this is, my understanding is that this is already a flexibility that is offered, and it's up to NHS Highland to ensure that that is delivered. And I'm not sure whether that's to happen, whether that's in a process right now, whether it's to happen before winter, but I'll make sure Mr Ewing is updated on the latest position from NHS Highland.
Mr Russell.
How vigorously do you monitor the output? Say, for instance, like NHS Lanarkshire, my own health board, say has a capacity of 100 cataracts, which was a very common theme on the doorstep about waiting 2 years for a cataract. So, say, for instance, the NHS 5 has a budget for 100 per week, but they only do 80. How do you monitor it and then coordinate the movement of people to take up the spare capacity in the other regional health boards?
Mr Russell has alighted upon an incredibly salient point that we have been working with boards on over the last 6 to 12 months on, around ensuring that we are optimising the capacity that is available within the system. Yes, in some cases asking people to travel, either from Lanarkshire to Fife, or indeed from Grampian to the Golden Jubilee, or up to the NTC Highland that Mr Mountain and Mr Ewing will be very familiar with, in order to ensure that where there is capacity available, it is being utilised where the demand is being led by. So it may well be the waiting times in Lanarkshire. Lanarkshire need help to get through their waiting times for cataracts, for instance. And that is exactly the process that's currently underway to optimise the planned care capacity and make sure that is optimised.
Edward Mountain.
Thanks very much, Convener. I too welcome the National Treatment Centre in Highland, and what it proves to me is that people can travel if they need to for healthcare. In the Highlands, we know that. We've lost our vascular surgeon, we've lost our interventional radiologist, and the reason is that we're told is that we don't have the population density which leads to the demand to justify having the services, despite in the case of the vascular surgeon having 2 operating theatres equipped for it and 12 beds, more than any other board in Scotland. So I'm interested, Cabinet Secretary, how you work out that populations in the Highlands won't always be the ones to lose out on services, despite the fact that they may have the equipment to deliver their health care. Because at the moment, the feeling is that we're in the Highlands, so we're going to have to travel. No one travels really to us for these specialisms. And when just to get to Regmore, it may take 2.5 hours from Wick or even more remote areas, that we've got a huge journey ahead of us first. So I'd be interested to know how you balance population density and services, because that's the reason we're told by the Highland Board we're losing all our services.
Convener, I thank Mr Mountain for raising this, as he has done in correspondence with me, and has been persistent in ensuring that the needs of his constituents in the Highlands are across my desk on this issue and others. I well know, as he will understand, what that trip from Wick to Inverness looks like. I commute that regularly, and so very well understand the challenge of accessing even a service within Regmore for other patients within the Highlands. In terms of vascular services, there is currently a national review ongoing around the national provision for vascular services. There is an interim position in place around supporting the very acute need that there is for support for Highland vascular services at the moment, and we are looking to move to a model that would ensure that there is a better vascular provision, not just for the Highlands but across Scotland, that is delivered on a population-based need, but also understanding the very clear points that Mr Mountain has raised around travel, both internally within the Highlands, but also from Highlands to other parts of the country. And I'll be happy to correspond with Mr Mountain on what that review is currently looking at.
Thank you. And just a quick follow-up, Mr Mountain.
Yeah, I don't think it's just vascular surgery that's the problem. It's the fact that we will never have the population density and therefore the demand to outstrip the need in Aberdeen or Tayside. So we will always lose our services till NHS Highland is hollowed out. That's what we're being told, and we just have to lump it. Do you agree with that, or do you think you must put some services, specialist services, in the Highland and force people to travel to the Highlands in the same way that Highlanders have to travel to get their services?
Thank you, Convener. I appreciate the point that Mr Mountain's made. I don't agree with the first point that he's raising. I don't think that it is an inevitability that services will always be lost from Highland, not least because on all of the points that I've already raised, there has to be a balance between, yes, the population-based planning, but also the safety and travel and access to services for people living within the Highlands as well, and the travel that's already involved for people to get from Wick or from Dingwall in order to get to Regmore, or indeed from Skye, where I was recently in the summer, and then the onward travel to wherever that service may be. That is not the way that we're approaching how services should be configured. And I think I've already given a good example of where we're seeing services being provided in Highland that people in the Central Belt are travelling to, and that's good evidence through the NTC Highland. I have no interest in seeing the situation that Mr Mountain has set out being followed through.
Thank you. Jackie Bailey.
Convener, I recognise the Cabinet Secretary's intention to optimise planning capacity, but the reality is this isn't being delivered in practice. And let me give you two illustrations. Firstly, waiting times in Greater Glasgow and Clyde are some of the most significant in the country, and we have the Golden Jubilee on their doorstep. And beyond the planned arrangement that's made at the start of the year, Greater Glasgow and Clyde seem reluctant to pass people on to the Golden Jubilee, despite the Golden Jubilee having the capacity to take them. Equally, waiting times for gynaecology, diagnostics and treatment in Glasgow are incredibly long, dangerously so, but in Lanarkshire, they are keeping to time. So why can't we have more cooperation across health board boundaries, which seem to act as a barrier to money flowing between them? Because I always thought there was one NHS, and maybe it's time to have the money follow the patient.
Thank you, Convener. These are points that Ms Bailey and I discussed at our most recent one-to-one discussion that I offer to opposition health and social care spokespeople on a regular basis, so we can have these levels of discussion, and I can give colleagues my vision and what our intention is, and also hear where the concerns around that aren't working from the examples that are able to be brought. In terms of Greater Glasgow and Clyde utilisation of the Golden Jubilee, I expect that to increase. There is clearly new management in place at Greater Glasgow and Clyde, as there is on an interim basis at the Golden Jubilee. And the point for both is exactly as I'd said in response to the convener and to others, that I am expecting, and we are seeing, a greater cooperation between health boards, between their boundaries, to ensure that capacity is being optimised. I recognise the point that Ms Bailey makes around cancer wait times in Glasgow compared to cancer wait times in Lanarkshire. Where can there be a greater cooperation there, either in terms of how Lanarkshire have been able to get to the point where they're meeting the targets, whereas other boards are struggling to, but also where there is that level of delivery in one health board area, does that allow them to pick up some of the challenge that is in evidence in other boards? And that's exactly the type of work that's currently underway.
Follow-up, Jackie Bailey?
I think patient experience tells me that that's not actually happening on the ground in a real way. So when would we expect this to make a difference that people can see?
That's underway now, so I would expect that to start improving as of now.
Okay, thank you. The second section is diagnostic and treatment pathways. Marie McNair is going to lead us through these thematic questions. Marie McNair.
Thank you, Convener, and good morning, Cabinet Secretary and your officials. Following on from earlier discussion, I'm interested to hear, on behalf of petitioners, but also on behalf of my own constituents, how the Scottish Government are supporting organisations committed to raising awareness, promoting research and providing support to people with rare cancers such as cholangiocarcinoma and other little researched conditions.
So we work on the cancer front. We work very closely with the Scottish Cancer Network and Scottish Cancer Coalition and individual cancer charities that either help to fund and support research or are looking for us to be able to provide that research funding. Cancer Research UK obviously has a large footprint in Scotland and have at the most recent session that they had here in Parliament, were recognising that Scotland leads the world in many aspects in terms of its cancer research work, and for that I'm incredibly grateful for the work that's done within health boards by clinicians, but also through the academic community and industry in looking at novel cancer treatments and diagnostic opportunities. And that is something through the triple helix approach that we are looking to see continue to advance. And I'm also conscious, as I am through the Less Survivable Cancers Forum, of the need to ensure that for some of those cancers that are hardest to detect, are less survivable, that we need to see earlier interventions and novel treatments coming through, and that is what we continue to work with that forum and the stakeholder organisations to help to deliver.
Thank you. And moving on from that, how are decisions made about, introducing sort of national screening programmes?
That is done in concert with the UK National Screening Committee. Like all governments across the UK, we take a lead from the experts at the National Screening Committee, and on those recommendations we then either seek to implement a national or a population-based screening programme, or indeed seek to target if that's more appropriate.
Thanks for that. That's me just now. I'll let my colleague Ferguson in. Thanks.
Thank you. There is one petition which is really amongst the very oldest that we have. So I'll let one of our very oldest members ask a question about it.
Most experienced.
Well, I'll take that as a compliment. No, seriously, Mary Ramsey has petitioned this Parliament since May 2019, 6 years ago, Cabinet Secretary, for some kind of adequate provision for essential tremor in Scotland. Since then, I understand she's been ably assisted by Rhoda Grant, MSP, so I haven't been acting for her personally. But Rhoda has been persistent, as has the petitioner, who has lodged no less than 6 submissions arguing that there should be an ultrasound provision, ultrasound capacity in Scotland to provide a national service. Now, there isn't, despite the fact that the NICE guidelines in 2018 recommended that there should be such a service. The National Services Division has repeatedly said, well, COVID was used as an argument for not doing anything for quite a while, but since then the argument seems to be that there's not enough money to do it. So the petitioner estimates there are 100,000 patients who have, people who suffer from essential tremor, which is a serious neurological condition, and there seems to be no treatment in Scotland for 6 years, despite the fact that NICE have recommended that there should be. Moreover, there is treatment in England. There is treatment and ultrasound equipment in Liverpool and London, I'm told. There may be more now. That information is a couple of years old. And that means that patients from Scotland referred to England have to travel to Liverpool and London. Maybe you can come back to me, CabSec, with how much that costs, specifically, if you could please, your officials, because that money is completely wasted and could have been used to provide a service in Scotland much more cheaply. But, you know, I just put it to you, Cabinet Secretary, that this is a pretty farcical failure. It's manifest. The responses from the Scottish Government that we've had have just said, well, there's no money and we're not really doing anything, despite the NICE guidelines. So is this not a manifest failure to provide a proper provision, as they have in England, for a very large number of people in Scotland who suffer from a debilitating neurological condition?
I thank Mr Ewing for his advocacy on behalf of Rhoda Grant and on behalf of Mary Ramsey, who was on Good Morning Scotland this morning, giving very good testimony to the situation. I represent a constituent that has an essential tremor as well, and have done for some time. And actually, there is a service being provided, the ultrasound service that Mr Ewing references in Tayside. I recognise that for some people having to travel, that is a challenge. And if they can't, for whatever reason, get to Tayside, then that is when the potential for onward travel to Liverpool or London is available. But, you know, if you're able to, I would imagine that for most people, if they're able to get to Liverpool or London, then they would be able to get to Tayside. But would keep under review whether that needs to be broadened beyond being a specialist service within Tayside, and whether that needs to go further. And clearly we'll work in concert with National Services Scotland if it is a service that has level of demand that would merit it beyond being one service provision in Scotland, then clearly that's something that we would consider.
Well, I'd be obliged if you could come back to the committee with the detailed answers about how many people you estimate need the service, how many get it in Dundee, how many get it in Liverpool, how many get it in London, what the costs are. It would be very helpful, I think, to have this information, convener, for the future. But could I just ask this? This is a more general question about the health service, which is that many people believe in Scotland that the money goes to the wrong place. It goes to far, far too many managers and bureaucrats. There are far too many medical quangos. And because of that, the money cannot be found to provide the direct services that everybody wishes. And there hasn't been any reform to the NHS since devolution began. That jaggedy thistle hasn't been grasped by anybody. Isn't it about time that we had major reform, not to spend the money on the managers and the bureaucrats, but but to provide some sort of at least basic national service. And I should say that I believe Mary Ramsey is with us today, taking the time again to travel down here to be with us today.
For which I'm very appreciative and happy to have a discussion with her afterwards, if that's helpful. Convener, I am grasping that particular jaggery thistle, and we are pursuing a process of reform. I pray and aid the current merger happening of NSS and NES in order to provide a new service on NHS delivery. We are blurring the boundaries between territorial boards to ensure that services are being delivered on the basis of it being a national health service, as Ms Bailey referenced it being earlier. Structural reform is, as he will be aware from his time in government, incredibly challenging, time-consuming and can be very costly and can distract from what we need to happen at the moment, which is an improvement in service delivery. And that's what I'm currently focused on, in ensuring that we improve and reduce waiting times, we improve people's access to services, and we are starting to see fruits of that particular labour of our incredible NHS staff. That's not to say that structural reform is not required and couldn't be taken forward, but right now I'm focused on getting the same outcomes, that the type of reform that Mr Ewing speaks of, without having to go through the pain and cost of a top-down reform process.
Can I just, I mean, the reason this petition remains open is because the committee have continually been impressed by both the perseverance of those who have raised the issue and by what we thought was the unarguable substance of the request. And so we've declined to be fobbed off, I suppose, is the best way of describing this over quite a long period of time. In the event that you are able to have a chat with the petitioner, who, as we've identified, is with us today, are you going to be able to offer her some positive assurance?
Well, I've set out in my response to Mr Ewing the fact that there is a service available in Tayside. I will obviously have that discussion with her as to whether that is sufficient for what she is looking for. It certainly was helpful in terms of my constituent and his need, and whether there is more that can be done. I'm clearly happy, as I've already committed to in response to Mr Ewing, happy to consider that with NSS.
There is a National Specialist Services Committee. And I suppose the committee would be interested to know, during the lifetime of this Parliament, how many recommendations, how many requests have there been that this committee has considered in terms of taking forward a national specialist service?
I would need to check that, Convener. I'm not aware of.
Is that something we could find?
I'm happy to provide that.
I suppose the committee would be interested to know what the productivity is of the National Specialist Services Committee, and just not only how many, but what the process is that is actually determines whether or not these services can be provided.
Ms McLaren advises that it meets quarterly, but I'm happy to provide a more detailed answer in terms of its productivity, as you put it.
Yes,
and I'm happy to furnish that in response.
My mother's bridge club meets quarterly, but that doesn't mean they're very productive. So, I mean, it's the productivity of these things that we're keen to establish. She's in her 90s, she can hardly see the cards. Marie Monet, have you further questions you'd like to return to? Okay, I mean, there is a petition we've got, Cabinet Secretary, in relation to the regulation of private ambulance services. And I mean, it does seem from petitions received that these public-facing organisations should be subject to some sort of inspection and registration. I mean, that seems fairly straightforward. But why does something like that take such a long time to try and implement?
So Healthcare Improvement Scotland are leading on this, and this is I agree we need to make progress here. At the same time, they are also working on the regulation of cosmetic implants and surgeries, which is also an area of pressing need for reform. My understanding is that this will go to public consultation, I expect, next year, and I expect there to be progress made in that regard.
Okay. Are any members of the committee? Davy Russell.
Yeah. On the theme of the diagnostics and the treatment pathways, it's about closing the loop. I can mention a case, it's actually at my desk just now, where one of my constituents get diagnosed with cancer, had a mastectomy in 2017, and now we're in 2025 and they still haven't had the reconstruction surgery. So which is totally unacceptable. But what I'm saying is, to close the loop, you know, what mechanisms are in place to do that? Because that's a vital part, because it's mental health, the women's mental health is at risk here.
Convener, I absolutely agree with Mr Russell. It is part of the cancer treatment, and that is the conclusion of the cancer treatment, and needs to be considered as such. I've met women that are in that circumstance in my role as Health Secretary, and I understand the pain, the anguish, the mental health impact that it has. The challenge that we've got is the demand upon cancer treatment services, and the same theatres that are used for sometimes very complex breast reconstruction surgery are also the same theatres that are used for the initial treatment. I think we need to get the balance right in terms of ensuring that we are concluding a woman's cancer treatment through the reconstruction surgery. But clearly, I think he would understand, as I do, the need to ensure that that initial treatment is prioritised, and we're currently working with the relevant boards in order to ensure that there can be a necessary recruitment of these specialist surgeons, so that we have an ability to get through these waiting times. Because I absolutely agree with Mr Russell, it's not acceptable, the length of wait that some are currently experiencing.
Okay, thank you. Sorry, just before I go to Jackie Bailey, when I talked about the ambulance thing, I should perhaps, I mean, you said it was out to consultation, and I asked why it was taking so long. It was first raised in Parliament in 2005, and there was a commitment to consult on this issue in 2012, which is why I say it seems to have taken rather a long time to take the matter forward.
Convener, you'll understand that both those dates predate not just my time as Health Secretary, but my time in Parliament. But I absolutely agree there is a need to address this. And we currently are. As I say, we expect the public consultation to start early next year.
Right. Well, for which we give thanks. Jackie Bailey.
Thank you very much, Convener. Two issues I want to raise. First is mental health services, second is GP services. And you have a petition from Karen McEwen, who lost her partner, Luke, to suicide, and he tried up to 8 times in the week before his death to get access to services. Now, I know in my area and across much of Scotland, crisis out-of-hours services are patchy. I know waiting lists for people to get mental health services are far too long, given that many will go into crisis quite quickly. Can I ask the Cabinet Secretary, given that increasing crisis for people seeking mental health services, will he undertake a review to improve it, as has been raised in this petition?
So I very much appreciate the petitioner's advocacy here, an incredibly challenging situation, more than challenging, a tragic situation for which I offer my deepest sympathies and condolences. I think a lot has changed since the petitioner brought this forward, and since the tragic situation that she is setting out. We have surpassed the commitment that we made to expand mental health practitioners being within accident emergency units, general practice surgeries and other locations. 800 that we had anticipated, we've surpassed that. I recognise that in many cases, and I have my own constituency cases where this is the case, that sometimes that still is not enough, and we need to still look to do better to support people in a crisis situation. I'm also keen, and this is where the government's real priority is to move further upstream and to prevent people moving into crisis in the first place, and look at the whole family support opportunities that allow for those the drivers of poor mental health around poverty, around the other environmental and social factors that colleagues will be aware of, are able to be addressed much earlier, so that the acute level of mental health demand is lessened, because clearly that's where we all would wish to be, rather than having to treat the symptoms at an acute stage when people are in crisis.
So I very much agree with what the Cabinet Secretary said, but where is the evidence that this is happening on the ground. It's not in my area, it's not in other areas. How do we stop people needing to enter the system at a greater degree of crisis to services that are either not there or are under such strain they can't cope with what's coming out?
So I would point Ms Bailey, first of all, to the Community Link Worker network that seeks to move upstream. I recognise the challenge that there are in some parts of the country with that, but the Community Link Worker network, particularly with regards to, and I know that there's a petition from the Deep End Practice network in order to ensure that that is expanded, and it's currently under national review, helps to ensure that people in a trusted place, which is the GP surgery, are able to then be signposted to other services for which the root cause of the issue that they're presenting to the GP surgery with can actually be addressed. Often housing, income maximisation, education, other elements of public service that can help to support, as well as which again is within the population health framework, the need to increase the opportunities that are available through social prescribing to address people's mental health issues. The Community Link Worker network is there for that, and that's where we seek to move upstream. Similarly with the likes of the Family Nurse Partnership and ensuring that we're moving as early as possible to support people much earlier in the journey than what we are at the moment, which is treating the acute situation.
So I think everybody would support the community link workers that are in the deep end practices and beyond. But the truth is, because there wasn't a dedicated income stream, Glasgow ended up cutting, I think, the number of community link workers they had. Western Bartonshire did too, and I'm sure in other areas that was the case as well. So how do we ensure that the things you're describing are actually on the ground when there isn't a dedicated funding stream to support it?
So we did step in, as she'll be aware, as Jackie Bailey will be aware, to support the provision in Glasgow. We've also established a national review of the Community Link Worker programme for exactly the reasons that she is setting out in order to ensure that that sustainability can be afforded.
One tiny last question.
Very quickly.
GP appointments, because that's the key diagnostic and treatment pathway, and people tell us all the time of the rush to secure an appointment, and they have to phone at 8 AM, they're in a queue, you're lucky if you're number 2 or 3 in the queue, and you hold on, and sometimes they hang up without securing an appointment. What are you doing to change that?
First of all, the provision of an 8 AM rush is in all GP practices. Same-day appointments are not the order for all GP practices, and it's GP practice responsibility to manage how their appointment system works. However, I recognise that for many that is the situation, and that is too often the case. The way to resolve that is clearly to support the expansion of the availability of practitioners, both general practitioners and those in the multidisciplinary team that can often see patients where it's not always the case that it needs to be the GP that sees them. We've expanded the multidisciplinary network and support, I believe it's over 5,000 currently through the various resources that we put in. And I'm currently in discussion with the BMA and the Royal College of GPs on their long-term funding position, which I think I responded to, I think it was the convener, to suggest is happening in order to ensure that they are able to recruit from the record number of GPs currently in training, 1,200 currently in training, so that there can be a greater level of employment, and that offers greater levels of appointments, reduces that level of rush that Ms Bailey speaks of.
Thank you, Convener.
Thank you. The third of our sections will be taken forward by Davy Russell. This is capacity, skills and training. Davy.
Yeah. Petitions this session have highlighted the gaps in capacity, skills and training, the lengthy waiting times, there's extreme. You're trying to catch backlogs up here, you know, where there's waiting lists to get down. And I know in NHS Lanarkshire they're using overtime, right? Which is it's fair and well. However, how do you maintain the skills level and the training aspect of this at the same time as at the expense of providing the service and working on the backlogs?
So for Agenda for Change staff, there is a protection for skills and training to allow for that to take place. Yes, we are asking our staff to go the extra mile currently in order to get that through that COVID-related backlog, for which I am incredibly grateful, and we're seeing activity levels increase and waiting times coming down. July saw us deliver the most operations within the NHS in Scotland going back to February 2020. So there is clearly a shift going on from the investment that's been put in and the endeavours of staff, as well as the optimisation of capacity to ensure that we are maximising the ability of the service to deliver. But I recognise that where we're asking staff to go further, then that is putting stress and strain on them while they're already in a stressful situation, and is putting at risk their ability to do that continuous training and upskilling. That's why the Agenda for Change contracts have within them the protected learning time, and that I expect boards to honour those.
We see that mental health services continue to operate under high pressure from growing demand. What are you doing to focus resources on prevention of mental health, or to put it another way, what are you doing to promote positive mental well-being in children and adults?
So on CAMS services, we've invested substantially over recent years to deliver a substantial increase in the number of child and adolescent mental health practitioners working, and that has seen us for the first time over 3 quarters now we've met the CAMS waiting times standards. There is a continued challenge around psychological therapies, which I recognise, but that again is being worked on. In terms of adult services, we have also provided substantial funding. The exact figure I'll need to be reminded of over recent years to community mental health and wellbeing for adults to support both the treatment but also that interventionist wellbeing support moving upstream. And as I was pointing out in answer to Ms Bailey, we clearly want to be moving upstream into a more preventative space. Clearly we need to be responding to the demand as we see it now and get through the backlogs that we have, but also we need to move upstream. The sustainability and the viability of our health service going forward means we have to move to a more preventative model. We cannot see it, the health service being a hospital being the first port of call. It needs to be the last port of call, and we need to move much further upstream in order to make sure that we're providing health and wellbeing services that support people's well-being rather than treating the symptoms in an acute setting, which is clearly not where we should be.
I know Ms Bailey is not going to want to overwhelm my largesse here and goodwill, but if you've got a quick point you'd like to get in, as we need to move on to the remaining sections.
I will try and be very quick. It concerns workforce planning. Health boards tell you what they need for the future. You put that plan in place for training. Yet last year, more than 100 paediatric nurses didn't get jobs. I know of resident doctors this year who haven't got jobs as consultants, so they're going to America, Australia, New Zealand, Canada. One even is an Uber driver in Edinburgh. What a waste of money. And we are spending millions on training them, but not giving them jobs. Why is that?
So Ms Bailey will receive correspondence, if she hasn't already, following up from the discussion that we had around paediatric nurses and the nurse vacancy point that she raised. That NHS Greater Glasgow and Clyde did advertise for additional paediatric nurses this year, so there are jobs available. I recognise the position in terms of resident doctors moving through specialty training, and that is something that we are working on because we need the increased capacity. We are working with boards to ensure that they have the resource to be able to offer those places, and that is in progress.
OK, thank you. The next of our sections is sustainability of funding and health service infrastructure, and Maurice Golden will take us through this.
Thank you. Cabinet Secretary, I wonder if you could update us on the short and long-term investment plans for the NHS estate.
So the short-term plans were set out at the budget. Those areas of priority and those projects of priority have been set out and were voted on within Parliament as part of the budget process. In terms of the long-term capital position, that is currently under review as part of the infrastructure investment plan, which we expect to bring forward as part of the budget and spending review process.
Okay, thanks for that. GPs have complained to me about working out of cupboards, repurposed, as well as patients, unfortunately, in a car park, which doubles as the waiting room. And I wonder if you could perhaps update us on the capital funding for primary care infrastructure, but also perhaps your thoughts on not just the creation of new GP practices, but actually community hubs that have a GP practice, links to the third sector, pharmacy, perhaps post office, banking facilities, and more of a one-stop shop. So the kind of two aspects to that, please.
I appreciate Mr Golden's question, and I have probably seen many of the facilities that he is referencing, because I have committed to go into a substantial number of primary care facilities in order to see the provision as is currently, particularly some of those that are most challenging, where there is a demand for either a replacement of those buildings or a need for renovation. And I recognise not just for the immediate delivery of services and the capacity that we require within primary care, but also to fulfil the policy direction that this government has given around shifting the balance of care, moving to the community hub model that Mr Golden is outlining. That's exactly what is contained within the service renewal framework. That's exactly the type of position that I'm wanting us to move to, and we are going to need to see a greater investment going into primary care facilities in order to allow that to happen, to allow for more hospital-based services to be delivered within the community. And so that is under active consideration at the moment under the processes that I outlined in my first answer through the spending review, budget and infrastructure investment plan processes. Clearly, some of that is determined by the capital allocation that we receive, and obviously, my very strong encouragement is for the UK government to expand its capital investment. It's good for the economy, it's good for public services, and it would certainly allow us to do much more. And we have clear areas of priority where that could be delivered against. But that's under active consideration and is a clear priority for me at the present time.
Thanks, Cabinet Secretary. As part of this thematic session, we've previously heard from experts around the use of technology in assisting the NHS, making it more productive, all the way from assisting diagnosis to, as we heard earlier, booking appointments. I mean, I think the only time I use the phone is for calling the GP these days. Everything else is online, use of apps, but also assisting GPs in terms of both capturing and triaging patient data, as well as alleviating delayed discharge through, I've had patients contact me, they were all good to go, the medication wasn't ready, they stay overnight again, and that essentially blocks someone else. But we have active solutions in the AI sector, and I wonder, one, how comfortable you are with the current usage of the technology and any plans for the future in this space.
So there is a substantial amount in Mr Golden's question which points to the future provision that we're going to need to get to in order to ensure that we're maximising the clinical capacity for the health service that only humans can deliver upon. We've already spoken about the demands that, the demands that are upon us in the health service, and we need to ensure that we are freeing as much clinical time as possible in order to meet those demands. So I point to a number of areas. One, we've got a theatre utilisation tool that is a digital-based product that has been rolled out across Scotland. I saw it tested, I saw it in demonstration in Lothian, and means that we're able to optimise clues in the name, the level of productivity that there is within our theatres, and ensure that the human estimations of how long an operation will take are being challenged through the application, and make sure that we've got at the maximum optimised level of bookings within that system. Secondly, we'll be setting out in detail very soon the rollout plan for the health and social care application, the app in Scotland. It's starting in Lanarkshire and will be rolled out from there, initially on a relatively minimal viable product basis, where it's about appointments, it's about access to vaccinations and what have you. But then how do we go and scale that up? And part of the discussions that we currently have with the BMA and the Royal College of General Practitioners, to Mr Golden's point, is on the data that we get from our general practitioners and how that can help to inform what can go through the app. Integrated across health and social care, giving people much more power within their own hands, but also save substantial amounts of resources in terms of appointments booking, in terms of other services that may be able to come through the app. And lastly, he referenced AI, and we've got really good examples of where AI is currently in utilisation in Grampian at the moment with regards to lung screening and other services that are coming through the system. We have got really good opportunities coming through where and again, when I was in Japan, able to see phenomenal work that's been done by some of our companies based in Japan, but working here in Scotland, that are looking at how AI can help to transform radiology. And so I think this is where, alongside moving upstream into a more preventative health service, also better utilising and seeing technology and advancements coming through the health service, that is where we meet the demands that are coming at us. A 20% expectation of increase in the burden of disease. How do we reverse that? How do we move forward? It's through the utilisation of innovation and new technology and on moving further upstream into preventive space. So I think Mr Golden has struck on an incredibly salient and pertinent point, and one that we are absolutely committed to moving forward with.
Thank you, Cabinet Secretary. Just two quick follow-ups on that. Clearly, the health tech sector, it's often new start-up companies, entrepreneurs that are getting involved, and certainly my experience historically, NHS boards tend to associate too much risk to contracting with that. I understand that, but then obviously you need to engage to be at the forefront, but that carries a significant risk. I just, in terms of that risk matrix, yep. I'm keen to hear your thoughts. And in terms of the app, my concerns is regarding the timescale towards, assuming it's successful, towards the rollout. The technology that sits behind that might well be outdated. You know, for example, it's like historically having developing a web-based system. By the time you've gone through all the protocols and controls and worked it up, no one's using a web-based system anymore. So I just wondered your thoughts on that as well.
So on the first point, I've been very clear with our health board, chief executives and chairs, my expectation on working with industry, with academia, on the utilisation of new health technology, medical products. We've set out a national programme of the adoption of health innovation called ANYA. It's led by the Chief Scientific Officer here, Damana Dominicek, very well respected across the health service in Scotland and indeed industry, and it's helping to pull together that triple helix that I referred to earlier of health service, industry and academia to make sure that we are coordinated. And I'll give an example to him because I recognise his concern about start-up companies, often spin-outs from university, that have in the past struggled to get access to the health service. That is changing. We've got the linkage between the TechScaler network and the NHS testbed, which means that the risk to those that are innovating is being reduced because they have access to health service clinicians that are telling them, yes, this is the type of thing that we need, no, this won't work in an NHS setting, and is then giving them the opportunity to be able to develop products and services that are going to be applicable to the health service. My challenge is making sure that that is then adopted on a national basis, rather than having to go down 14 boards to prove the technology, adopted on a national basis as quickly as possible. The second point that he raises there around how quickly we can adopt technology to make sure that it's not immediately outdated, that is something that's built into the digital front door programme, as it's described, but the development of the app to make sure that it is something that is going to be serviceable and can be utilised as it is rolled out and is still relevant to what people would need and expect.
Thank you, Cabinet Secretary.
Okay. Despite my best efforts to clip along, we are running a little bit behind, so I'm hopeful that we can move along to the final session very quickly. So can I just, there are three, I think, colleagues wanting to say something, so if we could hear from the three and then just address them all together. Davy Russell?
Yeah. You mentioned you were in Japan looking at the AI systems. Please tell me it wasn't Fujitsu.
Okay, sorry.
Fergus Ewing?
Yes, may I raise a question of which I've given notice to Cabinet Secretary regarding the pause on capital funding for new primary care, and in particular the example in my constituency of the Culloden Medical Practice, who for many years have been seeking to move to new purpose-built premises. They're the only practice in the Highlands that has had to close its books to new patients simply because of the huge pressure of the number of patients on its list. And I know that in other parts of Scotland, notably parts of Midlothian, for example, there may well be similar pressures. So this is not just about my constituency, but a wider issue. The practice has got a tough decision to make. Does it wait for the new premises it really needs, or does it go for a temporary solution of porta cabins, which themselves will cost £300,000? Now, they don't know, because they don't know when the pause is going to be lifted. So not only is the pause preventing the service to people in my constituency who cannot get into the practice, but also the practice themselves are hamstrung because they're not armed with information to enable them to make an informed, rational decision. Cabinet Secretary, can I suggest that the money can easily be found from the carbonisation fund of £200 million, where in one case the Scottish Government saw fit to spend an estimated £3,560,000 on a building worth £275,000, 13 times more than the value. Surely it would be better, rather than throw money away at such ridiculous, preposterous expenditure, to spend the money on the health service, which is really important to people's lives in Scotland right now.
Thank you. And just briefly, Edward Mount.
Be very brief, and thank you, Convener. Just as part of this whole idea of tech and putting power in the hands of patients, I think it's absolutely critical. And I'd just remind the Cabinet Secretary Petition 2031 is about insulin pumps for kids, and the fact that that is putting the power into the hands of children, and they need it because it stops them developing. Now, in Highland, we only get 8 pumps a year. That means the waiting list in Highland is 3 years for a child for an insulin pump. In the Central Belt, it may be no wait at all. And I just wondered if the Cabinet Secretary would consider that carefully. I'm not asking him to give an answer, but kids do need to have the power in their hands. Thank you, Convener.
Thank you, Convener. First of all, to Davy Russell's point, no, it wasn't. Second, to Mr Ewing's point, we obviously had a productive collaboration on resolving some of the pause for Granton in his constituency, and I was able to visit the fantastic Granton medical practice as a result of both the collaboration again with Mr Mountain and Mr Ewing, and I was very pleased to be able to bring that forward. My encouragement to Culloden would be to engage with NHS Highland on their prioritisation of capital projects, because we've currently asked all health boards to set out their relative priorities as part of the infrastructure investment programme, and that will help to guide those priorities for ourselves. So my encouragement to Mr Ewing and to his constituents would be to engage with Highland as to their relative prioritisation of that particular project or not. To Mr Mountain's point around insulin pumps, I absolutely agree. It's transformational for children's lives. We have made significant investments in order to bring this forward. I will write to the committee to set out exactly what that is. I don't want to provide figures from the top of my head that I believe to be correct, but may not be, around the level of investment that we've provided. But I absolutely agree with him that these are transformational for children and young people in particular, but also for adults who have diabetes as well. And I'll set that out in response to the committee.
Thank you very much, Cabinet Secretary. And that talks directly, actually, to Petition 2031, which is the providing of insulin pumps to all children, which is, I'm grateful for Fergus Ewing addressing. We are running, and I need Mr Ewing to clip-clop through his comparing of our final section, but I think he's going to preface that with just a quick follow-up to your remarks. This final section is post-COVID-19 impacts and response. Mr Ewing.
Thank you, Convener. Yes, it was just to thank the Cabinet Secretary for his last answer, except it didn't actually reply to the question, which was when will the pause be lifted? Because Culloden of course, they're engaging with the NHS Highland. I mean, they do so all the time. So, of course, that recommendation is one that they've been following for years and years. What they need to know is when the pause, will it be 1 year, 2 years, 3 years, 4 years, 5 years? And if you can't say, I mean, what are the civil service advising about this? Because
the Cabinet Secretary perhaps couple that with the response to the first question in the final section.
I'll do it that way.
Mr Ewing, if we could move to that.
All right, move on, Convener, to the first question, which, if I can find it, is post-COVID, how does the Cabinet Secretary see the NHS ability to recover from the problems of COVID, which plainly were all engulfing? And what is his personal commentary on how successful or otherwise that has been in restoring the full provision of services to patients across Scotland?
So, Convener, forgive me, I didn't address the direct question that Mr Ewing raised, but the answer is contained within response that I made to Mr Golden, which is that the infrastructure investment plan will set out, as will the spending review, our infrastructure investment plans, our capital investment plans. So he will get that as part of the budget process coming for this year's budget. This year's budget.
That will happen next February then, so they can wait till February.
The plans that we set out as part of the infrastructure investment plan will come through that process. So he will be able to see the plans that we have, both for the immediate period through the budget and infrastructure investment plan, and the spending review period coming forward as well.
So it will be an announcement.
In terms of
another prequel, you know, like sort of never-ending kind of process. Anyway,
I don't think the Cabinet Secretary actually had time to address the first question that you put on COVID, Mr Ewing, because you were so obsessed with taking forward the important matters affecting your constituents. Sorry, Cabinet Secretary.
For clarity, as I am, I think I've already set out the clear demand that there is for capital investment within the health estate, and I recognise that, and I want to move forward with it. As I do recognise the fact that our health service is still impacted with the effects of COVID, both from a waiting list perspective, where we are still working through those cancellations that took place during COVID, and the backlogs that we are currently working through, and indeed the fact that we are, as individuals, presenting at both general practices or indeed consultant clinics with more complex comorbidities than we were pre-COVID. Part of that is because, understandably, we asked people to pause some elements of their care, and so therefore we are catching up with some of that now. But also, I think, during COVID, as we were literally confined to our own homes, we started to discover more about ourselves, and we, as a result, with greater awareness raising, are also presenting and asking questions quite rightly about more of our care. So our response to COVID and the way that the health service has changed. Yes, it needs to deal with the backlogs. It needs to respond to the changing way in which people are presenting with larger, more complex issues, and also the greater awareness that we have of our own health. And that's where the 3 documents that we published earlier this year are all about. The Operational Improvement Plan is about the immediate operational demands that we need to address. Secondly, the Population Health Framework is about, on a population basis, we need to be better planning for our well-being, moving upstream into a more preventative model, recognising that this is not just a health service issue that needs to be answered. If we are to recognise the OECD's point that 80% of the drivers of ill health are outside of the responsibilities of the health service. They are environmental factors, they're social factors, they're the drivers that come from poverty. That's exactly where the government's prioritisation is going. And we need to address how, where and when we deliver our services, and that comes through in the service renewal framework, which is about that more structural reform that we were speaking to earlier. So COVID has had a profound impact on our health and social care services. That's why we need to take the concerted, targeted and determined efforts that we are in order to see those work through.
Yeah, okay. And just a final question, I think.
Yes. When can we expect to see the infection prevention and control strategy published?
I'll need to defer back in writing to that. I don't have that at my grasp at the moment, but I'll make sure that's part of the correspondence that comes back through.
Okay, thank you. That's been tremendously helpful, Cabinet Secretary, across a whole variety of petitions at this stage in Parliament. I'm very grateful to you for freewheeling across a very broad agenda of health issues, and to colleagues for their contributions. Is there anything you want to add to anything you've said this morning?
I recognise that we have cantered across quite a lot, and that we may well not have addressed all of the issues the petitioners have come forward with. And I recognise that for a petitioner to come forward with an issue the way that they have, often talking about very personal healthcare issues either affecting them or their family members, that can be incredibly traumatic and difficult to do. So if for whatever reason today's session has not responded fully to those, I'm happy through correspondence from yourself, convener, to be able to address any further points that there may be, because it's very important that we continue to address those.
Thank you very much. I'm very grateful for that, and to you and your colleagues, and we will suspend briefly. Back. Sorry, we're just waiting one of our colleagues joining us, but I think we can proceed. Thank you. We now move to agenda item 3, which is the consideration of continued petitions. And I want to say to all the many people who continue to have petitions open with us that we have now arrived at that point in the parliamentary session where time is pressing. And the committee will be looking at a number of these petitions carefully to determine what more we think we can do in the course of this session, irrespective of the merits of the petition. We have something like 120 open petitions and little time left in this parliamentary session in which to do justice to them. And it may well be, therefore, that notwithstanding the critical issues that are being addressed by the petition, it will reluctantly be our view that it will require to be something that is addressed potentially with a fresh petition in the next session of Parliament. And I wouldn't want any of those who might be joining us online or who are present to think that the issues in some of these petitions, particularly continuing petitions, which are continuing for the very reason that we thought the substance of the petition worthwhile for us to explore, does not continue to be that, but simply because we are not going to have the time in the current session of Parliament to pursue it in the way that we would wish. The first of those continuing petitions today, with a bit of a preamble, I'm sorry to say, is from me, is petition number 2113 to provide support to RAC-affected communities. This has been lodged by Wilson and Hannah Chowdhury. The petition calls on the Scottish Parliament to urge the Scottish Government to provide support to communities affected by reinforced autoclaved aerated concrete, commonly referred to as RAC, by setting up a national fund to assist struggling homeowners and tenants affected by RAC, initiating a public inquiry to investigate the practices of councils and housing associations concerning RAC, including investigation of how business related to RAC was conducted, the handling of safety reports and property sales, disclosure of RAC and responses to homeowner concerns, and introducing or updating legislation similar to the General Product Safety Regulations to ensure developers, councils and housing associations are held accountable for using substandard property materials, mandate risk disclosure and make surveyors and solicitors liable for untraced defects. Legislation should also include provision for a comprehensive register of high-risk buildings in Scotland. Now, we last considered this petition on the 13th of November 2024, where we agreed to write to the Built Environment Forum Scotland, the Royal Institute of Chartered Surveyors, the Chartered Institute of Building, the Royal Incorporation of Architects in Scotland, and, at that point, the Minister of Housing. The RICS suggests that a national fund, as requested by the petitioner, could be useful, but it has questions over its applicability and indeed its necessity, as existing surveys do not point to RAC being prevalent. The Scottish Government reiterates that the local scheme of assistance can in fact provide financial help. It also underlines local authority powers to decide spending priorities as well as continued challenges to public finances. Although the UK Government has shown reluctance in setting up a UK-wide financial support scheme, the Scottish Government continues to insist on one. In a recent response to a written parliamentary question, the new Cabinet Secretary for Housing states that she will engage with the new UK Housing Secretary on this issue following the resignation of the Deputy Prime Minister Angela Rayner. The RICS, the RIAS and the BEFS, the organisations to whom I referred a moment ago, were not supportive of a public inquiry, arguing that it would be both time and resource intensive, that it would divert from immediate response, and that it may simply confirm what is already widely known. Submissions suggested it would be more appropriate to identify and remediate affected properties which are also in a poor condition. The RICS does not see the third ask of the petition as a proportionate approach, and it points out to existing avenues which can be explored if RAC has not been properly identified by a regulated surveyor. The BEFS highlights the existing Buildings at Risk register paused following a review and suggests that any successor model should be more aligned with activity that renovates and reuses buildings at risk rather than lists them. Now, we've also received additional submissions from the petitioners, some of whom I think are with us in the gallery today, who continue to highlight the predicament of RAC-impacted homeowners and the urgent need for action, particularly on the financial front. And I'd like to acknowledge that most other submissions do recognise these challenges to homeowners and are generally in agreement that significant action will require to be taken to address this matter. But as I said earlier, in relation to the other aspects raised, we don't have a lot of time left in this parliamentary session. And obviously, so far as we might want to take further action, I think we would have to make sure that was quite targeted. Can I say just gently to those who may have joined us in the gallery today that it is the Parliament's position that there shouldn't be anything which is of a campaigning material overtly displayed within the chamber. But I'm not going to bring the heavy hand of bureaucracy to bear on these matters today, but simply mention them in passing for future reference and ask colleagues if they have anything they would like to contribute to our thinking and how we might proceed. Mr. Ewing.
Yes, I've noted that in the last time this matter came before us, with regard to the National Fund element of the petition, the first of the three asks of the petition, that it was suggested by members, I think perhaps yourself, Convener, that we get a response from the Scottish Government as to what is the upshot of their work with the UK Government to come up with a solution. Now, in response to that, there's been a submission from the new Cabinet Secretary, and in that submission, the new Cabinet Secretary says they're continuing to work with the UK Government. There is a new Secretary of State for Scotland. I mean, I strongly believe that it's no use Scotland blaming London and London blaming Scotland. The people in the middle, some of whom are here today, are the ones that are suffering, in some cases, from the threat of bankruptcy and very severe pressure. So I think this blame-passing thing is just not good enough. And because there's a new Cabinet Secretary, because there's a new Secretary of State for Scotland, Mary McCallan and Douglas Alexander, why don't they just meet and come up with a solution? I mean, this can't go on forever. And if it does, then it just brings into disrepute the Scottish Parliament and the UK Government and the UK Government. So it does nobody any good. So I do think that although time is short, we still do have about a third to two-thirds of a year to go. And we should try and use that time as we can. We've got no, just to explain to those members of the public who are here who have a direct interest in this, we don't have any budget or any money. All we can do is put pressure on the governments to try and do the right thing. So that's our job. And I think our job should be to invite the Cabinet Secretary to confirm that she will seek a meeting with her counterparts in the UK Government and she will come up with a solution. And also explain why in England people in Basildon have got money handed out to them and people here haven't. And also explain why the money is being restricted to monitoring and surveys and not actual repairs. None of these questions have been answered at all. So my suggestion, Convener, is, and I appreciate the constraints of the committee, and I'm not going to be pleading for every petition to be kept open for the reasons that you absolutely set out, correctly so, but in this petition, I do think there's really a lot of human misery which has been caused by this through no fault of their own, no fault whatsoever. And passing the buck, if I were people in the audience today, I would be pretty disgusted if that were allowed to happen. So I hope that members will agree that there is more that could be done. And they talk all the time about working together, don't they? How we work together positively. Well, let's see the proof. Let's see the proof, Convener. So that would be my suggestion.
If I think I can distill you correctly, Mr. Ewing, you're potentially asking that we act as a sort of marriage guidance counsellor and write to both the Secretary of State for Scotland and the Cabinet Secretary here, encouraging them both to meet to try and find a pathway forward that might resolve the issues in hand. And I think we could do so on the basis that this is a petition we take extremely seriously and that, given the time left in this Parliament, it would be helpful if both these parties would respond positively to our suggestion that they have that discussion. Yes?
Very diplomatically put, except I think they would regard me, the ministers, not as a marriage advice counsellor, but more of an agony uncle, I think, really.
Well, I'll say it was suggested by our agony uncle. Maurice Golden.
And thank you, Convener. I agree with Mr Ewing's point. In addition, I think it would be useful to get an update from the Scottish Government on how it is monitoring local authorities in terms of their interaction with affected residents. So, for example, in Aberdeen, there's regular updates, newsletters available to the public. But that varies from local authority to local authority, and the Scottish Government, in my view, should be monitoring, perhaps sharing best practice, and I hope that they are doing it, or perhaps it's a role for COSLA, but I think that should certainly be done, and I would appreciate an update from them on that.
Okay, we consent to keep the petition open and to pursue the 2 lines of inquiry, mindful of the fact that time is against us, but that we think this petition is one of those that we will seek to try and make some further progress on. Is that correct? It is. Right. Thank you very much. That brings us then to petition number 2116 to accelerate the implementation of bus franchising powers. This petition has been lodged by Ellie Harrison on behalf of Better Buses of Strathclyde. The petition calls on the Scottish Parliament to urge the Scottish Government to improve the process for implementing the bus franchising powers contained in the Transport Scotland Act 2019 by introducing without delay the regulations and statutory guidance required to give bus franchising powers full effect, amending the 2019 Act to remove the requirement for proposed franchising frameworks to be approved by a panel appointed by the Traffic Commissioner, instead empowering regional transport partnerships to have the final say on approving proposals, and providing additional funding to help support RTPs in preparing franchising frameworks and assisting them with initial set-up costs once frameworks are approved. And I would just remind those of us joining us today of the remarks I made a moment ago about campaigning material, all of which seems to have quietly moved into camera shot in the duration of the short interval that we've had. We have been joined by our ever one. I like a little bit of pantomime myself, so we'll pass. Never have guessed, Mr. Harvey. We'll pass on quickly to the colleagues we have, welcoming the colleagues who have joined us to consider this petition this morning. We have the aforementioned Patrick Harvey and Paul Sweeney. Good morning to you both.
Morning.
We last considered this petition on the 27th of November 2024, where we agreed to write to the 7 statutory regional transport partnerships, Confederation of Passenger Transport, Bus Users Scotland, the Traffic Commissioners for Scotland, the B Network in Greater Manchester, the West Yorkshire Combined Authority, Transport for Wales, UK Ministers, the Law Society of Scotland and key bus operators in Scotland. I'm sure some of those suggestions were made to us by Mr. Sweeney at the time, who's never short of a list of people we might like to contact. Many of the submissions we received recognised the value of franchising, although several of them highlighted work to explore more appropriate avenues within the broader, and I quote, toolbox for options for improving bus provisions, unquote, included in the Transport Scotland Act of 2019. Some submissions suggest that no one model would fully satisfy local needs, and indeed that bus franchising is less likely to be the most appropriate option for rural areas. Views were mixed on the petition asked to remove the requirement for proposed franchising frameworks to be approved by a panel appointed by a traffic commissioner. S Western supports this, while SPT recognises that the process is now enshrined in law and expresses some concern that any change may result in further significant delay and introduce more risks to the local or any local transport authority considering a franchising framework. The Confederation for Passenger Transport Scotland argues against a local transport authority approving its own proposal and suggests more robust guidance regarding panel members as a better solution. Now, many welcomed the reintroduction of the Bus Infrastructure Fund for 25-26. The Confederation of Passenger Transport Scotland argues that any financial support provided to Scotland's local transport authorities must consider all options to meet local needs. The Net Zero and Transport Committee undertook extensive scrutiny of this issue, including in terms of the secondary legislation asked for by the petition, with the last regulations introduced ahead of the summer recess. In response to the NZET convener dated 25 25th of June, the Minister for Agriculture and Connectivity explained that the draft statutory guidance was undergoing an internal review ahead of final engagement with stakeholders, and the Minister added that final timescales for publication, and I quote, will depend on the capacity of these stakeholders to consider and engage with the draft document. The Minister also indicated that the Government has no plans to modify the franchising process, arguing that the current model, and again quote, provides for rigorous scrutiny of local transport authority franchising proposals to safeguard the protection of passengers and the wider bus network from potential damage of a poorly developed franchise. So before inviting colleagues on the committee to consider how we might proceed in the light of all I have said, I will invite both of those colleagues who are joining us this morning to make some comments to the committee, and I'll invite Patrick Harvey to speak first.
Thank you very much, Convener. Good morning. And I appreciate that you've asked us to be tight for time and also that you're focused on deciding whether to keep petitions open in the hope of substantial progress in the remaining time available within this session. I'd like to make the case that there is an argument for urgency around getting some clarity during the current session on how we move forward for this. The committee is very well aware from its previous consideration that Parliament has already legislated in favour of allowing a local approach to franchising, that it is Scottish Government policy to allow a local approach to develop franchising. And what's been announced very recently is SPT have decided to press ahead with their proposals on franchising. So in the area that I represent, this is a matter of parliamentary consent, national government policy and local intention. And SPT's consultation showed a very, very strong public support for this. 83% of their consultation showed that people were not satisfied with the current situation and wanted to support franchising as an approach. In fact, the loudest voices that are against this are simply from those who've made themselves very, very wealthy by operating the current system that doesn't have public support and isn't meeting people's needs. So we have national policy, we have legislative parliamentary agreement to allow this to take place. We have local intention and we have public support, but we still have significant barriers in the way. Notwithstanding the recent decision that the convener referred to around the regulations, there remain barriers to progressing a franchising model and a lack of clarity about the degree of political and financial support that will be available from central government to enable us to make progress. If we don't get some clarity and some clear recommendations before the end of this session, I fear there's a real risk that we're going to be into the 2030s before people in Scotland, including in the area I represent, are able to benefit from Scotland moving forward to catch up with those other parts of the UK that are already well ahead of us on operating bus services in the public interest. So I would ask the committee whether to make recommendations themselves or to refer this back to NZ and seek a clear and specific set of recommendations about how the next session of Parliament will remove the barriers and provide the support that is necessary to enable much more rapid progress.
Thank you, Mr Harvey. Mr Sweeney.
Thank you, Convener, and it's a pleasure to join you again in support of this petition. I think the unanimity that SPT has shown in progressing the Strathclyde Regional Bus Strategy with the support of parliamentarians across the region demonstrates the level of public will to see a bus franchise implemented across Strathclyde and particularly in the Greater Glasgow urban core. But there are constraints facing the Regional Transport Authority in implementing the franchise that has been identified by the petitioner, particularly the resource constraints faced by SPT. So SPT have estimated 15 million to complete the complex processes set out in the Act, though of course if the Act were simplified, as the petitioner has recommended or suggested, in line with the 2017 Act in the rest of the UK, that cost could be reduced. So SPT have set aside £12 million in reserves to finance that work, but then between 28 to 31 they estimate £100 to £200 million to roll out bus franchising. So clearly there are resource constraints that may delay the implementation of the franchise that hasn't really been addressed, and particularly in context of the Strategic Transport Projects Review, which the Government has identified Clyde Metro as a major investment priority, bus franchising clearly is a factor and that will underpin an effective Clyde Metro. So there is a need to move this forward at pace, because the Transport Authority needs to get ahead and the Government needs to be in synchronicity with the Transport Authority in the region to allow this to be delivered at pace. We can't waste any more time with this. We've already had a delay, significant delays relative to other major British cities in getting bus franchising on the ground. So my suggestion is that the petition consider bringing the Transport Minister in to inquire about this in detail, about the issues of resourcing the franchising process, simplification of the legislation where appropriate, and potentially also consider a referral, like my colleague Mr Harvey suggested, to the Net Zero Energy and Transport Committee, which I do understand does have some capacity before dissolution to consider this in more detail. So there could be a collaborative opportunity between this committee and the NZ committee.
Thank you. Colleagues will note that we have, of course, have enjoyed the presence of the convener of the said committee with us during our consideration of matters this morning. Do colleagues have any suggestions as to how we might proceed in the light of the responses we've received and also the appeals that have been made to us? Mr Russell, sorry, just took the free wheel here.
If we dive into this at present, when the funding isn't secure, I think we could be in very thin ice. You know, I think that for a proposal to go ahead, I think you need to make sure that the funding's secured to sustain this, because it is a change, significant change. I think that's there's no point unless the funding is secured.
Thank you. Mr Ewing?
Yes, I would agree with that. I mean, plainly, you can't press the button on a project until you really are certain as to what it's going to cost, what the design will be, and what the timescale is. This building is an example of what can go wrong if you try to go ahead prematurely instead of festina lente, as the Romans may have said. However, it's been brought to my attention by McGill's, who have made a submission that they say, and I have no judgment on this, no prior knowledge of this, but they say that the experts have costed the funding requirements for the SPT case for between 45 million to 400 million. Now, I would imagine that our colleagues here would disagree with that, but the fact that they aver that experts say that that's the case would mean that were we to take this further, convener, I think we would really have to do a very full investigation, and I don't honestly think that we have the capacity or the time to do that with the best will in the world. It's just a matter of fact. Between now and the next year, we don't have the time to take evidence from all the people that would be required. So given that there is serious doubt about the cost, about the amount of money, given the severe pressures on finance, I think it's been pointed out there's a massive shortfall for local government finance, and given the people that are losing their jobs at the moment from some local authorities who may regard their jobs as a greater priority than a scheme which hasn't yet been costed, I can't really see that we can do much today other than urge the petitioners to come back to the next Parliament and continue to press the Government and work with SPT and other colleagues to try to devise a solution.
I imagine it was a late submission we received from McGill's, but I imagine they might be one of the parties to whom Mr Harvey was referring earlier. I'll say that just because he might have been trying to catch my eye otherwise. Any other colleagues want to? Maurice Golden?
I do think we should close the petition under Rule 15.7 of Standing Orders on the basis that, as Mr Ewing has highlighted and Mr Davey has highlighted, such a move would require funding, and moreover, the Scottish Government has reiterated there is no plan to modify the current franchising process. But I think in closing we should kind of do two things. One is write to the Net Zero Committee. It's helpful that the convener is present today, and well, he will once we've written to him, and also highlight to the petitioner that there is an opportunity to submit a new petition in the next parliamentary session.
I mean, I think this is actually quite an interesting petition, which is the reason that it's attracted a considerable degree of interest and engagement. The Scottish Government has reiterated that it's got no plans to modify the current franchising process. So, I mean, there doesn't seem to be any movement from the Government at this point on the issues, on that aspect of the issue contained within it. And I hear what colleagues say. I'm just trying to sum it. Is it our view that it's unlikely we can take this forward, but that there may be still aspects of it that another committee of the Parliament might be able to pick up on in the lifetime of this Parliament, and that therefore we would write, as Mr Golden suggests, to the convener of that committee in that regard, while closing the petition? And potentially suggest to the petitioners that this might be something that it would be useful to return to Parliament with in the next session. I mean, we only have something like half a dozen further meetings of the committee, so we are quite constrained. Are we agreed? Well, I think we are. I mean, I know it's not entirely the outcome our colleagues would have wished for, but I think, and I will just, in view as I'm slightly reluctant with our own conclusion, invite Mr Harvey, who I think is keen to come back.
I'm very grateful. I would acknowledge what you said about the government's stated intention that they don't wish at the moment to make changes to the legislative and regulatory process. The convener and other members will recall that the vote in Parliament on those regulations was on an absolute knife edge. So we have to accept that that decision has been made, but that a very, very strong counter case exists. But the petition I would draw attention to is not only about the regulatory and legislative framework, it's also about the level of resource and support that is necessary from government to allow the local intention and the local publicly supported intention to be taken forward. So there are aspects beyond the legislative and regulatory aspects which the government doesn't intend to make changes on, which will require further progress, will require movement from government, and I think the committee still has the opportunity to secure that movement in the last months of this session. Or
another committee might be able to do more than we can, given the limited scope there will be for us to return to the issues raised in the petition. I mean, I ordinarily wouldn't be inviting our colleagues to debate the matter with me, but Mr Sweeney?
It was just to draw the committee's attention to the fact that in June, the Chancellor of the Exchequer had announced a £15.6 billion investment in public transport for English city regions, with each receiving around £1 billion to £2.5 billion over the next 5 years to deliver or enhance bus franchising and deliver new bus infrastructure. And this would result in a Barnett consequential of approximately £1.3 billion. So it isn't as fatalistic, perhaps, as the committee may have assumed initially. There is a significant envelope of investment that we aren't aware of what the government's going to do with. So perhaps it could be an opportunity for this committee or the Net Zero Energy and Transport Committee to drill into exactly what the government's intentions are with that consequential in terms of particularly Strathclyde's well-advanced proposals for bus franchising, so that they can perhaps catch up with those city regions. And it may be prudent for the committee to hold the petition open until they at least receive a response from the Net Zero Energy and Transport Committee about their intended way to proceed.
I have this dreadful feeling that my sympathy in these matters is drawing me deeper into an abyss. Is Mr Mountain trying to catch my eye?
I was indeed, and I don't know if I have, convener. If I have, can I just say that I hear, and I've heard these calls in the committee before, and I can't answer at the moment, but there is no capacity whether we can do it, but there is no capacity that I can see in the committee's programme between now and the end of Parliament. So realistically, I would suggest that you may wish to write to the committee and the committee will consider it. But I'm gently saying that we have a climate change plan which is behind schedule. We have carbon budgets still to agree. We have an ecocide bill coming along the way already in the committee. And I don't want to discourage people from doing things, but realistically, convener, the problems this committee faces on petitions are multiplied, I would suggest, on the Net Zero Committee because of the lateness of the climate change plan.
Okay. I mean, I think reluctantly I am coming to the view that if that is the case, that given the limited time we've got, the route will have to be that we invite the petitioners to bring a fresh petition to the next session of Parliament. And I don't say that, happily, but I think that's the conclusion I'm drawn to. I'm not sure that exercising the suggestion of writing to the NZET committee is going to, is going to progress matters. So are colleagues content with, reluctantly, with that position? So I'm sorry, and I do apologise to the petitioner, and that would be our strong recommendation. But I feel we are kind of boxed in this particular issue because there are one or two other petitions still open that I think we can very directly make progress on, and it would be at their expense were we not now to have to come to some difficult decisions. So I thank everybody for their contribution and all of that, but I think that is the decision of the committee. That brings us to petition number 2118 to review and restructure Scotland's flood risk management approach and operations. This petition has been lodged by Tobias Christie on behalf of Spaymouth Environmental Partnership. The petition calls on the Scottish Parliament to urge the Scottish Government to review the Flood Risk Management Scotland Act of 2009 and improve flood alleviation and management processes by appointing an independent panel of engineers, economists and geomorphologists to support the design of flood risk management plans. We last considered this petition as well on the 27th of November last, when we agreed to write to SEPA and the Scottish Government. The Government's response confirms that its approach to flood risk management planning complies with the EU Floods Directive, and its approach to river-based management planning complies with the EU Water Framework Directive. On our question regarding a singular body being responsible and appointed to provide leadership on river basin management, the Government reiterates that SEPA is responsible for the preparation of river basin management plans on behalf of Scottish ministers, and that it is legally required to engage with stakeholders and consult with communities on flood risk management plans. The response concludes that ministers are satisfied with the current strategic framework, and it highlights the publication of its flood resilience strategy last December. The strategy establishes a flood advisory service designed to provide the framework and process for flood protection schemes, as well as support to communities. On our question regarding membership of local advisory groups, SEPA showed that these include representatives from various disciplines and organisations, but not engineers, economists or geomorphologists as standalone members. SEPA indicates various ways in which it collaborates with some such technical experts throughout the flood risk management planning process. And in his latest submission, the petitioner suggests that SEPA flood maps are inaccurate and have no community input, and that locally commissioned reports are ignored despite containing more flood scheme options. The petitioner highlights that SEPA consults with organisations with no legal responsibilities for flooding, but does not engage major landowners in the process. Fergus Ewing.
Yes, I should say that I've been in contact with Mr Mackey, who's been involved with this petition, I believe, Mr Jim Mackey, certainly the issues surrounding the petition. The petitioner has, as far as I can see, convener, responded on the 15th of January 2005, and I can't see any further response to that. And I mention that just in case I'm wrong, but the papers I have before me don't show any response to the petitioner's submission of the 15th of January. If I'm wrong with that, maybe the clerks could let me know. The reason this seems to me to be very significant is this, that in reading the petitioner's submission of the 15th of January, there's really quite very serious number of criticisms of SEPA. Their maps are inaccurate. They don't do any flood prevention advice. They stymie schemes. It's almost impossible to get sediment and gravel out of rivers. The barriers to actually doing any prevention work are considerable. SEPA don't involve communities at all. They have no community input whatsoever. They've got no remit to design, build or assist communities in building flood defences. And therefore, and I've just mentioned a few, convener, because plainly there's not time to go through the whole thing. But I do think that our job is to, where a petitioner raises very salient, serious criticisms, that our job is to try and get answers. So I know there is pressure to close petitions, all petitions really, but in this case I think it would be a very simple ask to require SEPA to deliver and request SEPA to deliver a very detailed response to each and every one of the very serious allegations. And the last thing I'm saying is that I've recently had a case in my constituency of a scheme for affordable housing, I think around about 20 units, which took about 10 years to get through SEPA. And it was supposed to be in a flooding area, except the houses were actually going to be built higher up than existing houses that have never been flooded in Nethy Bridge, where there's been no flooding since 1837. And SEPA were a constant stumbling block to any progress whatsoever. And this is happening in rural Scotland, and Mr Mountain may, I'm sure, have experience of this, that behind the scenes, when you try and do things that everybody wants to happen, like affordable housing, it's blocked by quangos that won't come up and meet with people, that won't explain their actions, and rely on desktop information. So I just merely add that by way of spice as a local anecdote to kind of support the petitioner's criticism of SEPA. And I don't think it would take much more time of this committee necessarily if SEPA do provide to the Commissioner a detailed forensic reply to every single one of his criticisms, and that would take matters further.
It's always a pleasure to shine a light on the events of 1837. Maurice Golden.
Thanks. I mean, I certainly agree with Mr Ewing in the general point of writing to SEPA, perhaps not quite in the manner in which was elucidated by my colleague, but nonetheless, I think the pertinent points are there. And I think this goes back to a theme of petitions. Who is responsible? We've heard it with RAC, and I've seen it in Angus with Milton of Finavon, flooded in 2023. A year later, 2024, no measures put in place to protect the community. Subsequently, in the last year, there's been some support from Angus Council as well as SSEN, and I thank them for that. But it was only for the grace of God that we didn't have a bad storm season in 2024, and that is unacceptable in my view. The Scottish Government have said that the government's structure for assisting communities in flood risk management is adequate, but actually what I hear on the ground, that is not the case. It's slow. There is limited opportunities for action and no one's taking responsibility. So in addition to Mr Ewing's point, I think we should write to the Scottish Government asking how they are monitoring the government's structure and interaction between communities and SEPA, local authorities and landowners where appropriate.
Perhaps couple that with an observation about the fact that SEPA have not been responding to the petitioner's submissions or directly to the issues raised, and that this is not untypical, and the Scottish Government should understand that that is so.
Of course.
Yeah, and that appears to be typical. Yeah. Okay. All right. Are we content to proceed on that basis? We will. Petition number 2121 to run a roadside litter awareness campaign. This is a campaign lodged by Carolyn Phillip, and it calls on the Scottish Parliament to urge the Scottish Government to run a campaign targeted at companies to raise awareness of the harms caused by roadside litter and the penalties that could be brought against responsible parties. We last considered this petition on the 5th of February 25, where we agreed to write to the Scottish Government. We've been joined by our colleague, Rachel Hamilton, this morning for consideration of this petition. Thank you very much. I've spotted you in the gallery, waiting for the sun to burst forth on the interest that you have. So welcome. We've received a written submission from Transport Scotland, which states that as there has been an increase in discarded litter over the past few years, Transport Scotland believes there needs to be a change of mindset and a campaign undertaken to discourage people from dropping litter. Transport Scotland will work with our operating companies, Keep Scotland Beautiful and Zero Waste Scotland, to run a campaign targeted at companies and also the public to raise awareness of the harms caused by roadside litter and the legislation that is in place to penalise those who drop litter. The Scottish Government's response lists the organisations that have delivered publicly funded litter prevention campaigns and details the funding provided to roadside litter campaigns since 2007. The response also states the Scottish Government remains committed to the principle that extended producer responsibility EPR for packaging should cover the full net costs of both binned and ground litter clear-up and disposal. The submission notes that the EPR scheme administrator is expected to set out its plans for for public information campaigns and its strategy and the specific activities it proposes to conduct for the coming year in its operational plan. And before I invite colleagues to decide what we might do, given that it would appear that potentially Transport Scotland wants to take forward the objective contained within the petition, I'll invite our colleague Rachel Hamilton to say a few words.
Thank you, Convener. And absolutely right. It's very topical in September with the sun bursting forward, and I'm driving along the A1 as the bottles with urine-filled bottles are glinting in the sun, as well as the rubbish on the A1, which brings me to the substance of the targeted campaign by the petitioners. And back in February, when this petition was last before you all, I highlighted the tremendous voluntary efforts that are going on into clearing Scotland's roadsides, and groups such as the Berwickshire Anti-Littering Group, led by Carolyn Phillip and Myra Watson, who I'm very glad to say are here today and behind me in the gallery. And many others across the country dedicate their free time to tackling what Keep Scotland Beautiful has rightly described as a litter emergency. And in Berwickshire alone, volunteers are out on the aforementioned A1 and in local laybys week after week, simply because they care about the environment and they care about their local community. And I actually joined the Berwickshire Anti-Littering Group myself in Duns this year in April. In just 1 hour, we filled a bag of litter weighing 7.3 kilograms, and that's just proof of how much can be collected in such a short space of time. It was rewarding, but it's very frustrating for volunteers, because we know that the litter is going to return very quickly, and that's why we need systemic action, not just goodwill. Since February, the committee has received fresh submissions, and Transport Scotland has recognised that the roadside litter is increasing, and that clean-ups are futile without behavioural change, and that a campaign is needed to discourage people and companies from discarding their waste on our roads. The Scottish Government's response also acknowledges the role of commercial vehicles, and Section 18 of the Circular Economy Scotland Act 2024 does provide for civil penalties when litter escapes from vehicles, even unintentionally. And that's a welcome step, but it must be matched with communication and enforcement. And the petition, I believe, doesn't ask for the earth. It calls for a targeted awareness campaign to ensure companies understand their responsibilities and the penalties that apply. We know that from previous campaigns, such as Give Your Litter a Lift and Scotland is Stunning, let's keep it that way, that well-designed messaging can shift behaviour. There has subsequently been no consistent national campaign focused on roadside litter in recent years, and that's despite public demand and cross-party support. I believe we cannot keep relying on volunteers such as Myra and Carolyn, because the Scottish Government is delaying, and the petitioners are right. We just need definitive action. A targeted roadside litter awareness campaign is overdue, and I urge the committee to support it. Thank you.
Thank you very much. May I say that your specialised knowledge of the contents of bottles on the A1 is impressive, if alarming. But thank you for your contribution. Do we have any suggestions? I mean, the Scottish Government is proposing, Transport Scotland are proposing to take forward the aims of the petition. Mr Russell?
Yeah. I totally agree with what you said. In a former life, I was Director of Roads, Transport and Environmental Services with Glasgow. And every now and again, we had the campaigns that you suggest with Keep Scotland Beautiful and Zero Waste Scotland, and they work to a reasonable extent. However, it's education that really we need to get to the kids, so that they're chastising their parents when they're throwing stuff out the cars. That originally we didn't have the budget to carry through the educational part of this, which links into what you're saying, but really that was it's all right, cleaning, lifting bins, there's a process, but really that's not where we need to be. We need to get the educational part so people don't do it. That's the bottom line. No, so it's a mindset change, and the only way you'll do that is through education.
Thank you, Mr Russell. Mr Golden?
Thank you, Convener. I mean, welcome the comments. I mean, I think actually, in terms of what the petitioner's asking for, we now have a situation where Transport Scotland have acquiesced the petitioner's request, and they will run a campaign targeted at companies and the public to raise awareness of the harms caused by roadside litter, and have the legislation in place to penalise those who drop litter. So on that basis, and perhaps in a more positive sense, I recommend that we close the petition under Rule 15.7 of the Standing Orders.
Okay. Are colleagues content with that suggestion? We are. So we thank very much the petitioners. I think hopefully we have achieved some progress on this particular petition. And of course, if that progress fails to materialise or satisfy, we would very much encourage the petitioners to come back to the next session of Parliament and tell us that that is so. Well, gosh, Miss Hamilton.
I kind of guessed this is what the members of the committee would say today, and I've read. I'm really grateful for what you've done so far into gathering the information regarding some of the steps that will be taken through the Circular Economy Bill, and I do have a concern though, because the National Litter and Fly Tipping Strategy Delivery Group recognise there's an interest in a campaign on litter, but they say that it cannot be achieved within the resources available to delivery partners. And I just wanted to put that on record, because I think it is really important that you cannot say that you're going to do something and then not allocate the resource to be able to carry that commitment out.
Thank you. That is duly on the record, as you hoped. That brings us to petition number 2127 to develop a new digital connectivity plan for the Highlands and Islands, lodged by John Robert Erskine. Is that our former our former media officer here in the Petitions Committee? The petition calls on the Scottish Parliament to urge the Scottish Government to develop a new digital connectivity plan for the Highlands and Islands that aims to address digital infrastructure gaps, improve mobile internet coverage, establish public-private partnerships, support economic growth, education and healthcare. And we last considered this on the 19th of February. The response that we received from the Scottish Government, to whom we agreed to write, is that it has no plans to develop a distinct digital connectivity plan for Highlands and Islands, explaining that there is substantial activity ongoing to improve connectivity across the region, but it is not apparent that developing a separate approach for the Highlands and Islands in isolation would add any immediate value. The submission points out that the Scottish Government will be publishing a refreshed digital strategy, taking into account connectivity priorities and a new National Islands Plan, which will integrate digital connectivity with other key priorities, making a separate connectivity plan unnecessary. Colleagues, any suggestions for action? Mr. Golden.
Thanks, Convener. I mean, I really appreciate the difficulties in connectivity, particularly in rural areas, but even in urban areas, to be honest. And appreciate how the petition must be so frustrated in that. But ultimately, I think in this case, and with a heavy heart, I think we should close the petition under Rule 15.7 of the Standing Orders on the basis that the Scottish Government has no plans to develop a distinct digital connectivity plan for the Highlands and Islands. They will publish a new Highlands and Islands plan this year, so any month now, which will integrate digital connectivity with other key priorities. And they will publish a refreshed digital strategy which will take into account connectivity priorities.
Thank you, Mr. Golden. Are colleagues content to... Here we are. So we will close the petition on the basis that has been suggested. That brings us to agenda item 4, which is the consideration of new petitions. I should just let colleagues know we're running some 40 minutes later than we might have planned this morning, unusually so. And to those who might be joining us as we consider these new petitions, and these are some of the final new petitions that we are going to be able to introduce in the course of this parliamentary session, we do nonetheless undertake a certain amount of work in advance of this preliminary consideration, in that we will have asked the Parliament's independent research body, SPICE, to offer its view, and we will have asked the Scottish Government for its preliminary view as well. And we do that because prior to our doing that in advance, it very often was the first action that we did, and all it did was delay more substantive consideration of the petition. Petition number 2159 is to halt the production of hydrogen from fresh water, and it's been lodged by David Mackay on behalf of Innis Community Council. It calls on the Scottish Parliament to urge the Scottish Government to place a moratorium on the production of hydrogen from fresh water until scientific studies are undertaken to understand the impact on the environment, local economies and society. The Spice briefing explains that all hydrogen production technologies require water as an input. Green hydrogen production is the process of separating the hydrogen atoms from the oxygen atom in water via electrolysis. Blue hydrogen production involves steam methane reformation and thus also includes H2O as a fundamental part of the process. The briefing notes that there are different conclusions on how much water is required for different methods of hydrogen production, meaning there is no single view on which method has the lower water footprint. The Scottish Government's response to the petition states that regulations are already in place for any activity which may affect Scotland's water environment, including the use of water from hydrogen developments, which require authorisation from SEPA. The submission also highlights the mechanisms within the planning process, stating that it will be for the relevant authority to interpret and implement relevant planning legislation and guidance in each case as it deems appropriate. Now, the petitioner's written submission points out that SEPA is reporting longer, hotter and drier periods in Scotland. The petitioner believes that longer periods of time and more rain will be required to recover groundwater levels. He states that any process that abstracts additional groundwater will exacerbate the situation and will have major impacts on the ecology, environment and the economy. The submission states the Scottish Government's response demonstrates a lack of understanding and knowledge of the production requirements for hydrogen. The petitioner states that neither the Government nor the hydrogen industry has calculated the total volume of water required to produce the hydrogen required for domestic and export markets, nor how groundwater will be replenished. Do members have any comments or suggestions for actions? Mr Mountain waving at me. Well, I didn't know that you had an interest in this petition, Mr Mountain, but in for a penny, in for a pound.
Okay, thank you very much, Convener. And before I say anything, as this petitioner lives on Speyside, I just want to remind the committee that I have an interest in Speyside in relation to my freshwater fishery on the River Spey. And I have responded to a particular application to do with Storiga at Mary Park, which is on Speyside. But if I just draw the committee's attention to one or two matters which I think are critical within the petition. First of all, I don't think...
Adroitly would be helpful.
Sorry?
Adroitly would be helpful.
Well, I'd never know what that means, Convener, but...
it means as quickly as possible.
I'm not sure politicians know what that means then. So basically, if I could just say, is we understand, and I understand, how important water is across the whole of the Spey and every other catchment. The Spey, for example, has never seen such low water levels since 1975. Water levels this year have been just phenomenal. We've had no increase in water since February. All other abstractions on the Spey at the moment are halted, except for the abstraction to Loch Harbour. So SEPA allowing water to be taken from the top of the catchment, but preventing it being taken anywhere else. Now, this abstraction that is being proposed is massive. It's 500 cubic metres, 500,000 cubic metres of water being taken out on a daily basis, which would be hugely detrimental, I think, to any river. And I think that where we need to consider as a parliament is how these applications are considered. Now, I understand that the Petitions Committee is running out of time during this session, but what happens is SEPA says they're doing river basin management planning. They're absolutely not. They're considering each application as it arises. And the cumulative effect of all of these applications are going to be hugely detrimental to every watercourse, especially in this particular case on Speyside, because it's going to increase the temperature of water. The water's being taken from substrate with a very high mineral content, which is going to be discharged back into the river, which is bad for mussels and creates algae. So whilst I don't think that the petitioner wants to halt all the production forever, they want some sensible consideration to be taken. So I would urge the Petitions Committee, rather than just close the petition, to consider writing to SEPA and asking them how they're going to consider this application in light of all the other applications which are already consented to, because just adding one more may be the final straw that breaks the camel's back. Convener.
I don't know that we were talking of just closing the petition, Mr Mountain, but thank you. Do colleagues have any suggestions for action? Mr Ewing?
Yes, I think we're grateful for Ed Mountain's factual input here, and I would certainly concur as representing part of the River Spey in my constituency that water levels are all-time low, and add that, of course, many existing users have already been prejudiced by that, notably distilleries. And I don't have any personal interest like Mr Mountain other than being an avid consumer thereof of the distillery products. But it does seem reasonable to say that the existing users and the existing businesses that traditionally have relied on access to water supply should have their interests considered by all of those whose job it is to oversee decisions with this regard. And I think there's an analogy with the pump storage situation of a plethora of pump storage applications and a lack of sort of joined consideration of the overall impact that they will have in Loch Ness. So I do think SEPA should be asked to comment specifically with regard to Mr Mountain's evidence, which I thought was quite was interesting, but on the face of it quite compelling. And it would certainly be very worrying if there were to be a massive extraction permitted without considering the overall impact. So I would suggest that we do write to SEPA as Mr Mountain suggested, but that also, Convener, we should include this petition as part of the thematic evidence session with the Cabinet Secretary for Climate Action and Change. And I think beforehand invite the Cabinet Secretary to respond as well to what Mr Mountain has said, because the lack of consideration of cumulative impact of developments across the board, notably renewable developments in the Highlands, is a huge concern at the moment, as Mr Mountain and I know from attending a packed public meeting over Mr Lumsden as well, I think, did attend it as well, not as a participant but as a spectator from out with the Highlands and Islands area. And this is a real concern at the moment. So this cumulative impact issue, without labouring the point, never would wish to do that, Convener, is one which I hope both the Minister and SEPA could opine on before we hear evidence, oral evidence from the Minister.
Was that what you were going to suggest, Mr Golden? Well, the only point I would make is I wouldn't want the date that we might be able to see the Cabinet Secretary to be conditional on him having responded in advance. So, yes, we can seek to get that response, or perhaps the Cabinet Secretary would be in a position to speak to the response that might be made in the event that we were having a meeting with them at that point. Yeah. Thank you. That brings us to petition number 2160. To introduce an energy strategy lodged by Tina Dawn Marshall, and it calls on the Scottish Parliament to urge the Scottish Government to publish its energy strategy and just transition plan to address the environment, infrastructure and land use. And we've been joined by our parliamentary colleague Douglas Lumsden to speak to this petition this morning. I think this is a return ticket from only having just walked out the door after our last meeting. Mr Lumsden has beaten a path back to join us. Good morning, well, almost good afternoon to you shortly. The Spice briefing reminds us that the Scottish Government's first energy strategy was published in 2017. This followed by a draft energy strategy and just transition plan published for consultation in 2023, with the finalised version still awaiting publication. The Scottish Government response states that the issues in its draft energy strategy and just transition plan are affected by ongoing developments in the UK Government's energy policy, including consultations for which responses haven't yet been published, as well as various court cases. The Scottish Government stresses that it is taking sufficient time to analyse these developments and their impact on Scotland. In terms of alternative action, the Government response highlights its 2024 Green Industrial Strategy, as well as its investment in skill development throughout its Just Transition Fund. It also flags the publication over the course of this year of a bioenergy policy statement, Solar Vision Sectoral Marine Plan 2, Offshore Wind Policy Statement and, most importantly, of its draft climate change plan, which it expects to publish for consultation later this year. We've also received submissions from the petitioner, who mentions a range of ongoing concerns in the absence of an energy strategy and just transition plan. And Mr Lumsden, the floor is yours.
Yeah, thank you, Convener. It's good to be back. I fully support this petition calling for the Scottish Government to publish its energy strategy and hope the committee has more luck than me trying to get it. I checked back the official report. In the last 18 months, I've actually asked the government 16 times on this. No answer. Maybe that's a reflection on me. And I read the no, just the 16 times, Convener. And I read the response to the committee from the government with interest, and they claim that they are taking time to analyse and reflect on developments. But it's been 2.5 years since they published that draft policy. You know, how long do they need? And that's been 2.5 years since they published, since, you know, there's been 2.5 years of uncertainty, 2.5 years with a presumption against oil and gas, 2.5 years with no just transition plan, while thousands of jobs are being lost in the North Sea. And in all that time, without a strategy, it seems like we have a vacuum. And maybe that is what the Scottish Government are actually trying to do. Because that vacuum is being filled with a presumption of unlimited, expensive onshore and offshore wind and all the infrastructure that comes with it. And we also must presume that generation and demand are in different regions. So the future will be mega pylons and substations and the damage that will cause to much of our beautiful rural areas. We've heard that just in the last petition, hydrogen, you know, we don't have a plan of how much hydrogen we'll be producing. Battery storage is out of control, often called the Wild West. It seems to be a money-making scheme where they buy up cheap electricity because we're building too much intermittent supply and selling it back when prices are high. Now, we know that the Scottish Government are blocking new nuclear power stations, but we don't know what their stance is on new gas-powered stations, for example. We now must presume that base load in the future will be met by imports when the wind is not blowing, and we should be concerned about grid stability as the inertia from traditional power stations is withdrawn. I know that's something that Fergus Ewan often brings up in the chamber, and this all matters because we need to plan properly to avoid blackouts in the future like we've seen in Spain. Now, I'm coming to the conclusion that the government are not coming forward with an energy strategy because that would mean they would have to be honest with people with what their vision is. Because I presume that their vision will see rural communities covered in battery storage, onshore wind, substations and mega pylons. And our rural communities are mobilising against this. We heard earlier about the meeting in Inverness, where the Highlands Community Councils came together. We've got a meeting coming up soon in Aberdeenshire, where the community councils are coming together there. And the same thing is happening in Perthshire and the Borders, with the exact same fears. But they are feeling ignored, and they just want some clarity and honesty from the government. So for the sake of our rural communities and also for our oil and gas workers, I would urge the committee to ask the Scottish Government again to set out some timescales so we can have some clarity going forward. Thank you, Convener.
Thank you, Mr Lumsden. You asked how long one needs to reflect after 2.5 years. If you'd been with us at our evidence session earlier with the Cabinet Secretary on private ambulance regulation, you would have heard that we've been reflecting since 2012 on how. So you may not be so long after all. But I think that raises an important issue, and I wonder if Mr Golden would like to suggest how we might proceed.
Thank you, Convener. Yeah, I'm very concerned that the Scottish Government is pointing to the fact that due to ongoing developments, they have been unable to produce their energy strategy. I can't think of my entire time working in the energy sector there's ever been a time when there hasn't been ongoing developments in some part of the sector. So I don't see that as any reason to stall what is a 2.5-year stall on the strategy. But I stand to be corrected. If over the last 15 years there's been a point in which there's been no ongoing development in the sector, then the Scottish Government will surely write to the committee regards to that. I think secondly, given it has been 2.5 years and there's, agencies, dozens of civil service staff poring over this strategy, then at the very least they could, the Scottish Government could provide where they are at the moment with it, a kind of energy strategy 1.0 rather than risk further delay. It will need to be updated, and I'd certainly offer my help in helping them to deliver that. And I think this should also be added as part of the thematic session with the Cabinet Secretary for Climate Action and Energy, which looks a lot more interesting after this session.
It's certainly a lot busier. Mr Ewing?
Yes, I think Mr Lumsden has raised many salient points, many of which I agree with, and the threat to the stability of the grid because of the impending closure of nuclear stations. The uncertainty surrounding Peterhead means that without baseload and backup, it is more difficult to provide stability, synchronicity, and therefore inertia to the grid. And it's a technical topic where I think more facts, more scientific analysis, less politics would be extremely useful in Britain. But aside with that, the Robert Gordon University report, I think it was by Paul Delow, whom I know, warned that the oil and gas industry in the UK could lose 400 jobs every fortnight, which is a quite staggering figure. There's lots more that could be said, Convener, particularly that Britain cannot have an industry unless energy costs are on a par with at least our European neighbours, which they're not. And therefore, industry is likely to cease to exist where it is energy intensive in Britain within the next 5 years, a point that one just doesn't really hear very much. But in any event, I just raise a few issues. But my suggestion about what we do with this is this, that I would be hesitant to recommend closing the petition, even although I know the pressure is there. I do think we should write to the government suggesting that there should be a full debate in Parliament. I would suggest of a full 2 days, actually, at least 1 day, on energy to allow us to have a proper debate with lengthy contributions from people that have an interest in the topic from all parties, because it is a very complicated, wide-ranging debate. But the idea that you can't have an energy policy because of development, as Mr Lumsden has said, is absurd. There's developments all the time. That's just not a reason, it's a pretext. So I think that it would be reasonable for us to suggest that the degree of interest in this, Convener, is such that there should be a parliamentary debate. But I also think that we should, and I note the petitioner is a student studying at Heriot Watt in the economics of renewable energy. She's made a lot of useful points to us. But I also think that we should raise these issues with the Minister for Climate Change and Energy at the thematic session, which we're having soon, and I think that would probably have to be quite a long session, because I'm sure there would be many members that would wish to participate, and rightly so.
Thank you for that, Mr Ewing. So that's two colleagues who have suggested that we add it to the thematic, and I think in advance of that, a letter asking where we stand currently with the energy strategy, and also Mr Ewing's additional question to the Cabinet Secretary, or additional suggestion to the Cabinet Secretary, that in addition to our addressing it in a thematic session, it would excuse me, it would be useful for Parliament to consider these issues in a chamber debate. We can suggest that accordingly. So we'll keep the petition open. Thank you, Mr Lumsden. Thank you. Petition number 2163 to develop guidance on child contact domestic abuse. Let's go down here so I continue. It's not. Sorry. This petition has been lodged by Alistair Scott. The petition calls on the Scottish Parliament to urge the Scottish Government to work with partners to develop guidance on the interaction between child contact dispute processes and the Domestic Abuse Scotland Act of 2018. Now, the Scottish Government's response to the petition indicates that it did not understand the main ask of the petition. It states that it is not clear who such guidance would be directed towards, nor what it would be intended to achieve. The submission then details the routes that can be taken during child contact disputes. The petitioner has provided a written submission outlining his concerns that led him to raise the petition, and he points out that mediation is not suitable for abusive relationships. He states that the parent seeking contact is then left with no other option but to progress matters through the courts, and explains that contact dispute cases can be used to further abuse those parents. The petitioner acknowledges that family courts will always be concerned with protecting a child from abuse or possible abuse from the person seeking contact. However, he believes this results in a disregard of the impact that false and malicious allegations have on the parents seeking contact, and he shares that false and malicious allegations have a profound impact on the mental health of the abused parent. Do members have any suggestions as to how we might proceed? Marie McNair.
Thank you. To write to the Scottish Government to clarify that the petitioner is asking for the Scottish Government to lead the development of guidance on the application of Domestic Abuse Scotland Act 2018 in circumstances which is claimed that the child contact dispute processes are being used to abuse a parent with the aim of helping all those involved in child contact disputes understand how best to protect the rights of those involved, and to ask whether it would undertake such exercise.
Thank you very much. That seems a sensible recommendation in light of the petitioner's further explanation of their concerns. Are colleagues content? We are. That brings us to petition number 2164 to ban all non-essential single-use plastics. And this petition has been lodged by Tabitha Fletcher, and it calls on exactly what I said a moment ago, the ban on all non-essential single-use plastics. The Spice briefing for this petition explains that single-use plastic products are used once or for a short period of time before being thrown away. It continues by highlighting the scale of the issue and its negative impact on environment and health, quoting the OECD's description of it as one of the great environmental challenges of this century. In summarising the government's action to date, the briefing mentions that some new product restrictions may require either a UK-wide approach or an agreed exclusion from the UK Internal Market Act principles. The Scottish Government points to past and ongoing action it has taken in relation to many of the asks within the petition's broad scope. The Circular Economy and Waste Route Map sets out actions to accelerate progress towards a circular economy, including on problematic single-use items. On a more targeted basis, the Government points to legislation to ban plastic-stemmed cotton buds, the proposal for a minimum charge on single-use cups, minimising plastic pellets in the environment, and its ban on single-use vapes. It also makes reference to the four-nation work underway to tackle packaging waste, plastic wet wipes and aquaculture gear, whilst reiterating its commitment to the deposit return scheme. The Government states that further detailed evidence gathering, consultation and impact assessments would be required in order to assess the petition's asks on any actions not yet being taken. And in additional submission, the petitioner also acknowledges the complexity of the action called for, whilst underlining that the existing pieces of legislation targeting specific items only go to show the viability of her petition. Do members have any suggestions as to how we might proceed? Mr Golden.
Thanks, Convener. I appreciate where the petitioner's coming from. However, I certainly feel that the ask may be counterintuitive in some places in terms of the application of the waste hierarchy and indeed the circular economy. However, in considering this, I think we have to look at the legislative programme in place, which is that the Circular Economy Act was passed in 2024, and currently a strategy is being developed by the Scottish Government, which would consider the petitioner's ask in the round. I would say to the petitioner, I'm very frustrated at the progress on this. In 2016, there was a circular economy strategy, and since then, the Scottish Parliament has introduced legislation with the sum total of to produce another strategy a decade on after the last one. But nonetheless, we are where we are, and I hope that the Scottish Government, in both producing and delivering the strategy, will be able to meet the general asks from the petitioner, and on that basis I would recommend closing the petition under Rule 15.7 on standing orders.
Thank you, Mr Golden. Do any colleagues have any suggestions, or are we content to proceed as Mr Golden suggests? We are, so we thank the petitioner, but for the reasons identified, we feel we aren't able to take that petition forward in the time available to us. Petition number 2165, raise awareness of and provided educational resources and training for functional neurological disorder, FDM. The final new petition for consideration today is petition 2165, and it's been lodged by Michelle Moyer. The petition calls on the Scottish Parliament to urge the Scottish Government to help improve awareness of functional neurological disorder by providing funding for training and educational resources for medical professionals, including GPs, paramedics, call handlers, employers and wider society on the symptoms and impacts of FND. From the SPICE briefing, we find out that functional disorders include dissociative seizures, functional movement disorders such as tremors or spasms, and functional limb weakness. The briefing helpfully points to the introduction of a national FND pathway in Scotland in 2024, but suggests it is not clear what training is available to primary care medical and nursing staff to assist with diagnosis in primary care. The Scottish Government considers the asks of the petition not to be achievable, as developing and disseminating new resources to provide training and education to medical professionals requires additional budget not currently available, unquote. The Government also considers that current work addresses the concerns raised in the petition. Such work includes the FND Pathway, a project for a dedicated clinical network in NHS Lothian, due to conclude this autumn, and a pilot study in NHS Grampian, which looks to enhance knowledge and diagnosis of FND. The additional submission from the petitioner, however, contains a series of questions stemming from the Government's response, including the need for mandatory rather than just voluntary training, the public sharing of data from the two regional projects currently underway, and the Government's next steps. Do we have any comments or suggestions as to how we might proceed? Marie McNair.
I certainly welcome the pathway, but I think obviously in order to assist the petitioner to write to the Minister for Public Health and Women's Health and ask for a response to those questions raised by a petitioner in that additional submission that you've already mentioned, and what preliminary assessment has been made of the pilot projects in the NHS Lothian and NHS Grampian, including in terms of the potential to be expanded on a national level.
Thank you very much. A suggestion that we keep the petition open and seek further information on that basis. Are we agreed? We are agreed, and that brings us to the end of our public session this morning. The next session will take place on Wednesday, October the 8th, and thank you for joining us.